It's the first time seeing you, Sam.
What? Hey, everybody.
Yes.
Good evening, good evening, good evening. Thank you so much for joining us. It is really a pleasure, and we're so grateful to have you. As you know, I'm Sam, the technical liaison here with the Association of General Practitioners of Jamaica. And we would love to welcome you to our virtual seminar tonight, Bridging the Gap, Interactive and Complementary Approaches in Modern Medicine and Ethics. I love when ethics is involved, and I know you guys are also looking forward to it. And we have some wonderful presenters to come and speak to you tonight about the topics. But I have said enough. I'm going to hand over and put you into the capable hands of a wonderful lady, Dr. Jacqueline Elaine Campbell. Over to you. Have a good one.
Thanks, Sam. Good evening, everyone. Welcome to our seminar, and our seminar is Bridging the Gap, Integrative and Complementary Approaches in Modern Medicine and Ethics. And this is organized by the Association of General Practitioners of Jamaica. We have quite an interesting lineup of speakers tonight. I can't wait to hear what they have to say, and I know that you also are waiting with bated breath to hear from our speakers tonight. So, without much more to say at this point, let me go over to our recorded message from Dr. Abrikian. Sam?
Good evening, everyone. Welcome to the seminar tonight, put on by the Association of General Practitioners of Jamaica. We'll be talking about how it is that we can integrate alternative medicine, integrative medicine approaches with the more standard westernized medicine approach. This is really a very relevant topic. Patients are often coming to us with knowledge and information about or having already tried alternative remedies and treatments. So it is our duty, I think, to be in the know about what exists out there, so that we can have discussion with the patients, so that they can relate to us and will be willing to share, and so that we can be more confident in offering advice as to what may be safe, what may not be safe, and what can complement other approaches that we may be suggesting as well. The speakers lined up are very qualified to give us very up-to-date information, and hopefully the information we get will not only lead to lively discussion, but also just give us some practical information that we can take home and use, importantly, in our day-to-day practices with patients. So it allows us to be more confident, allow the patient to feel more comfortable with us, and allows just for generally a more holistic approach. So enjoy the discussion this evening, and hopefully everyone will take home something good from it.
Thank you, Dr. Abrikian. Let us begin tonight's proceedings with prayer, and let us bow our heads if we can. Dear Lord, we start this meeting by asking for your abundant blessing. We know that you love to bless your children and that Jesus Christ has secured all of our blessings for us. We boldly ask that you would pour out your richest blessing on this seminar. May your presence be felt in our midst. In your word, you have promised that the blessing of the Lord makes rich, and he adds no sorrow to it. We ask that you bless each person present with your grace, wisdom, and favor. Thank you for being a God who is always generous and loving. Thank you for blessing us in ways we cannot even imagine. In Jesus' name we pray. Amen. Now, I have the distinct pleasure to introduce our first speaker, someone who I've known for quite some time now. And the speaker is Dr. Janice Simmons Fisher, and she is Clinical Director, Regenerative and Anti-Aging Consultant, and she is the Clinical Director of Bioregeneration Integrative Medical Center. which is an innovative and cutting-edge healthcare facility. This center specializes in therapies and advanced medical treatments that place a special focus on regenerative medicine, overall wellness, and longevity. Now, her protocols involve the use of technology, lifestyle, and biological therapies, and include stem cells, platelets, and other growth factors used to promote faster healing, as well as, interestingly, erectile dysfunction reversal, peptide therapy, to address various health concerns and integrative weight loss program. Dr. Simon Fisher is a graduate of the University of the West Indies, Mona School of Medicine. She also holds a Doctor of Natural Medicine degree from the Pan American University in plant-based therapies. Dr. Fisher is the pioneer, we should say, of stem cell work in Jamaica, and she has spent some considerable amount of time of her 22 years of clinical practice working in medical tourism and stem cell repair. Dr. Fisher, over to you for your interesting presentation. Um, can you share your screen for us, please?
Thank you, Dr. Jackie. I think I've known you for the better part of my 22 years, so my entire medical
Yes,
career, right?
yes,
As you
that's
were
true.
a mentor and inspiration to me and still continue to be. Thank you so much
You're
for
welcome,
having me this
Janice.
evening. And hello, colleagues. It is my distinct pleasure to just join you this afternoon to talk about a topic that has been my passion for 22 years. So, my topic for you this afternoon is an introduction to integrative medicine and how we can use integrative medicine in chronic disease management and enhance patient outcomes through a holistic approach. So we're trying to move away from I would say, the dichotomy of the fractions in medicine and to look at where we can achieve some semblance of harmony. And I wanted to kick off by just going through some definitions so that we have the jargon correct. And then we'll identify some ways of incorporating integrative medicine. And I really want to have enough scope at the end for a lot of question and answers, just looking at case series and any discussions that you would want to have on how we would manage any chronic disease in an integrative sense, be it pain or diabetes or weight loss, and provide some recommendations for future developments. So the definitions, this is going through the semantics. For traditional medicine, this one has been advanced by the WHO, and it really refers to those health practices, approaches, knowledge, beliefs in incorporating plants, animals, and mineral based medicines, spiritual therapies, manual therapies, and exercises that are applied singularly or in combination to treat, diagnose, and prevent illness or to maintain well-being. And a lot of times when we talk about traditional medicine, we tend to be talking about plant therapies. And it's taking that, let's say, ginger tea when you have some nausea or some turmeric and ginger wherever there is inflammation. It's when the patient says, I'll take some home remedies, and if that doesn't work, then I'll come into you. And of course, we have this big umbrella of complementary and alternative medicine. We use the term complementary and alternative medicine or CAM practices for everything that's not considered part of our conventional or allopathic medicine. And so the term complementary is used when it's together with our standard medicine. So let's say antibiotics and probiotics. And alternative is used when we're using it instead of a conventional medicine. And ethnobotanical medicine is really traditional medicine when plants are being used. So the integrative medicine really is the purview of the medical doctor. To be an integrative medicine practitioner, you have to be a physician. And so for any particular specialist area, we can have an integrative model. So we have integrative cardiologists, integrative neurologist, integrative oncologist. And when you go to integrative conferences, there's sometimes 6 to 10,000 practitioners across all disciplines. And they're here to just really have this biopsychosocial approach and expand it to not just look at the biological, but look at the psychology and look at the social approaches of medicine. And so it combines mainstream therapies with CAM therapies, but only those CAM therapies for which there is a high quality of scientific evidence of safety and effectiveness. And there are 5 big domains of CAM. We have what is considered alternative medical systems, and those would be your Ayurveda out of India, traditional Chinese medicine, it could be homeopathy, it could be naturopathy, and these are their entire systems of diagnosing and treatment. So we would have, let's say, a particular plant that is used, or several plants for diabetes, high blood pressure, or so on. So those are alternative medical systems. And then you have what we call mind-body interventions. And if I tell you that this includes a lot of our psychotherapies, this includes meditation, this includes prayer. And so, whenever we pray with a patient or a patient believes in prayer, that is actually a complementary and alternative practice. And of course, biological based therapies. And this has come a far way, because I will tell you that 20 years ago, if we wrote a prescription for B complex or fish oil, it was heresy. It was like nobody knew what this was. You may be killing the patient, and it was a lot of fear. And there were people like Dr. Jackie Campbell, our moderator, who spoke on the radio, who educated us on nutrition. And no, I dare say probably 80% of my colleagues write some vitamin or mineral. And it's not considered that way. And we have drug companies who have their B vitamins, their triple distilled, molecularly distilled fish oils, and so we're being detailed on them now. But the idea is that these are complementary and alternative medicine practices, whether we use magnesium, melatonin, any sort of plant or herb extract for any therapeutic benefit. The manipulative and body-based therapies are the 4th domain of CAM, and these may include massage, it may include chiropractic, osteopathic, and even some forms of physical therapy. Then there is the energy therapies, and energy therapies usually, I would say, is like biophysics. It looks at magnetic fields. It could be ultrasound technologies. It could be TENS devices, Rife machines. And so a lot of what has been incorporated into traditional medicine now, it's really an integrative model. So when you look at some of the common examples, when you look at manipulative and body-based therapies, the massages, when you look at mind-body therapies, most relaxation measures, spirituality of all sorts, yoga, those are mind-body therapies. And we have alternate medical systems using things like chamomile tea or any tea in particular, any plant-based. The energy medicines and of course our biologicals would be our diets, our herbals, and our vitamins. In fact, my introduction to nutrition was at TMRU at UE with Professor Marvin Reed at the time and Carolyn Taylor Bryan. So it wasn't at a naturopathy institute that I later went. It was at UE. And so it just was outside of the medical training. We had to go into TMRU and to do the research in that area, but it was all encompassing. And so why should we even care or bother to think about integrative medicine? And here is why. We have probably, and these data from Eisenberg go back quite a bit. So we have probably over 30,000 herbs on the market, and the compound annual growth rate is in the teens. It has an estimated market value in the billions of dollars. And it is said that 42% of patients are utilizing some form of CAM. It may be vitamin C, it may be prayer, but it is so much wider than we know And because it is such an important part of their practice, it's important that we have discussion around it. It's important that we shed light around it and look at ways that we can enhance patient outcomes that are evidence based and are safe. There were actually more visits to camp providers than primary care general practitioners in this study. And the question was asked why? What was it that was not being offered by our general practitioners or primary providers? And there were several sort of reasons cited. There were dissatisfactions with the healthcare provider. Sometimes patients had experienced side effects and there were high health costs, especially, in the US, but that is vastly the reality of Jamaica as well. But then there were others who felt like there was a lack of control in their own health. They wanted to know what they could do to make this better or to manage it. And sometimes it was the time spent with the doctor, especially those insurance based health systems where the insurance told them how much time they would have with the doctor. Other drivers for integrative care where patients were looking for cures, they didn't want to accept that this was a situation, that there was nothing that was available. Some were looking for natural products and trying to reduce the chemical burden in their system. Others felt more empowered. There were others focusing on emotional well being and thought it was better served elsewhere. And the practitioners came across more patient centered. So, and the thing about it is that we have this situation where, we have half of our patients seeing another practitioner and we are completely unaware. And most times, if you don't ask, are you on any vitamin supplements or herbs, they won't volunteer. And some thought the doctor just wouldn't approve or wouldn't understand, or it wasn't important that you know. And of course, there are drug or herb interactions, there are nutrient drug interactions. There are all of these situations that can impact how the patient is managed. But 70% of the time, we didn't know that there was concurrent treatment by another practitioner. And for many patients, it was because they felt like that doctor would not be able to entertain the discussion. So the idea was mainstream medicine relied on the double-blind placebo-controlled clinical trials, and the camps seemed to be more individualized, more personalized. The placebo effect was not discounted, but of course, the treatments would need to have high degrees of effectiveness. And so here it is that people were traveling around the world for alternative medicine, and we wanted to look at how and why we would want to offer these treatments. So I've put together about 7 sort of models of incorporating and integrating an integrative or holistic approach. So the first one is within an integrative model of care where physicians are trained to utilize both. And so there are many textbooks on complementary and integrative medicine. In the US, there's a consortium, but there is a group or some foundation within every big continent. And there are many universities that are within the consortium of integrative medicine providers. And I dare say every self-respecting university has a integrative medicine division. And it's not a corner room, it's buildings and divisions that are dedicated to integrative medicine, providing treatment options for patients. And so there is a Duke Integrative Medicine, there is a Mayo Integrative Medicine, Sloan Kettering has buildings dedicated to integrative care, Harvard, and there are many, many, many universities. We have clinical fellowships available in many areas. There are academic or research fellowships available for integrative medicine, and in some universities, there are residencies, clinical residencies. So the integrative model of care is there for those who want to expand their repertoire And whether it is in a limited sense or an expansive sense, it's going to be more or less incorporated into medical training as we move forward. It can be used as an alternative model of care. And the WHO has put forward a traditional medicine strategy. And they have put forward some priorities for the promotion of traditional medicine. And here is why. They have told us that 80% of this globe, of the world, relies on traditional medicine for their primary health care. And we may feel like we're not in a resource poor area, but this is the reality of our times. And so they've put out together working committees, and some of the policies include documenting traditional medicines and remedies, creating stronger evidence based on the safety, effectiveness, and quality of CAM, and developing national policies to evaluate and regulate CAM policies. We don't regulate CAM in Jamaica, so although we have to register and have these continuing medical hours and we have these reporting bodies, most CAM practitioners are kind of out in the wild. Promote therapeutical use of CAM for both the providers but also the consumers, and ensure availability and affordability of CAM, especially those plant medicines. And you go to every pharmacy and there are a ton of plant medicines, tons of therapeutic teas on the shelves, and a lot of it is not really regulated. So we would say that this area is an area, the traditional medicine market, that feeds into a lot of what we are able to offer. But there are also some non-toxic therapies that we can use in particularly ill patients. There is acupuncture sometimes for nausea and even for pain. There are athletes who use it when they can't use a number of remedies. Yoga has been shown to strengthen lung and reduce asthma attacks. And Tai Chi can help with transferring weight and reducing falls in our elderly. But there are also drugs, well, plant extracts that have been standardized and are dispensed in hospitals throughout Asia that are used in models of care where we do our labs, we treat with these plants, we repeat the labs, and once we see resolution, then we can take them off. The WHO recommends to different nations to cultivate and conserve medicinal plants. Of course, UWE has a natural products division to formulate policies and to regulate the mechanisms to control the safety and quality of the products because CAM is with us. And to create awareness about what is safe and what is effective in different areas. Now, let's talk a little bit about how a holistic approach can help with the management of stress. And the type of CAM that really shines for stress is what we call mind body therapies. And I had the opportunity to have actually taught mind body therapy at a university and I was just blown away. I just taught it, I didn't write the curriculum. But I was so profoundly moved as a physician, it changed the way I practiced medicine that I thought of just approaching the university and saying, let's give this gift to every medical student. But one of the areas I wanted to kind of highlight as a case study is the Benson Henry Institute at Harvard. And this is an institute that does a lot with mind body medicine and stress. So they will take the most refractory patients who have failed everything that money can buy. And they are recruited from top hospital systems. And they may come in with insomnia, best sleep specialists, nobody can help, refractory pain, regional pain syndromes, and just no resolution, infertility, cancers that just keep recurring, and they don't adjust medication, they don't touch the medication. They teach these people the relaxation response. And the premise here is that there are receptors on our immune system for all of the stress hormones. And during a period or extended chronic stress, and the body is really stuck in this stress response, turns off the immune system. And the body is being told, don't repair, don't do anything, don't even move. I'm positioning myself for a life threatening emergency. So, no matter what the doctor throws at you, there is no help, there is no repairing these people. And so they teach them the relaxation response, which is the opposite of the stress response. And they are guided through a number of therapies and could be color, sound, light, could be talk therapies. But they're able to get these biofeedback. It could be that they're watching their brain waves and they can see when the relaxation response is being triggered. Of course, there are physiological response on the skin, on blood pressure, on heart rate, on brain waves. But these physiological measures are monitored, and the patient knows when they're entering the relaxation mode, and so they can repeat that particular, um, let's say, ritual until it becomes habitual, that they may do deep breathing, that they may do meditation, or that they may do progressive muscular relaxation, whatever technique, and they're able to enter into the relaxation mode where the body heals. Because we have, I guess, rest, repair, and digest, and then you have stress. So when there is stress, there is no rest, there is no repair, there is no proper digestion. But what they show is that in just teaching these patients the relaxation response, they're able to actually achieve remission in 60% of their cases. So we have insomniac sleeping, infertile persons conceiving, cancers in remission, refractory pain that has resolved. And they say that 60% of what brings the patient before us in our offices has a stress component that we neither are able to see or treat. And the Institute puts patients at the center of care to address the full range of physical, mental, emotional, social, and spiritual influences. And in their cohorts, they have been able to reduce hospital visits by 43%. And this sort of wellness approach is coming of age. Our very own ministry is now health and wellness. So we're looking at incorporating these therapies, and most doctors do. We will, say, well, Joan, we think it's your father's death. Why? The pressure is high, and we need you to look at these three things to manage the stress in addition to this blood pressure tablet. But it's really understanding just how fundamentally important managing that stress is for any amount of repair to take place. Now we have chronic disease management, which is really where I think we wanted to talk a bit today. And how I'd like to phrase it is that when you look at the treatment in a medical textbook of any disease, Parkinson's, diabetes, let's say diabetes, we have a little line or a little paragraph on lifestyle treatment. And we may say, eat a balanced diet, exercise, and then it goes into 40 pages of drug therapies, sulfonylureas, meglitinides, thiazolidine GLPs, whatever drugs that we're using, insulins. And so the integrative approach actually expands the lifestyle therapies. And it may go into the type of nutrients, the type of diet, and it may expand the exercise. We may say resistant exercise, and we may say resistance in zone 2. And so there are 4 zones in exercise, and we can tell you which zone you will burn fat, which zone you will burn carbs, and that sort of thing. And maybe look at different repair peptides. But it may be useful in patients who, one, have maximized all the drugs and just not getting anywhere. It may be in a patient who just wants to reduce their drug burden, who feels like they have too many pills taken, whether it's 10 or it is 50. And they want to know, what can I do to really reduce this? And we have daily discussions, not just on, let's say, controlling diabetes, but on reversing diabetes. This is a conversation we can have. Um, and what just immediately popped in my head was actually a case that I had while I was working with Jackie. 22 years ago. And I had this patient who came in for flu, but she had this really bad rash. And while I was writing a prescription for some antibiotics, antihistamines or so, I was asking, and she said, well, I'm really allergic to my thyroid meds. So I thought, why not change it? And, then she said it's only one drug that was available in the island at the time. And her doctor, who taught all of us and is brilliant, said you either take this or you die. So she took her thyroid pills, but to counter the really terrible itching she was having, she was on high dose steroids and like 8 DPH a day, which eventually brought her to diabetes, high blood pressure, obesity, and she had a heart attack about 3 months. And I thought about it. I mean, she didn't come to me for this, and it really wasn't even my business. And I said to her, what if I told you there was something else? And I was particularly afraid and, really afraid because I had so much reverence for her doctor too. And she said, what do you mean? I said, well, I know that your doctor looks in this basket. And what if I told you there were 12 other baskets and I could look in? And I thought of something, could have been nature thyroid, armor thyroid. There were so many other things. And I said to her, try this. And she had very good control of her thyroid symptoms. Her labs showed that she was euthyroid and she was able to come off the high dose steroids, which, was causing this diabetes and all of that, and the 8 DPH. And I saw her some years later and she was just so grateful. So it's not always, sometimes it's something different, but for one person, it may be the world of difference. And I have done cases where we've had sicklers who couldn't go to surgery because, just really bad candidates. And who had an avascular necrosis, and we were able to do growth factors to help with repair of the joint. Took her almost a year, but she mineralized, she mobilized. And so it's finding these cases that we would leave to Malinga, who we wouldn't even look, we have nothing to offer, and who were just suffering. It doesn't, I mean, sometimes it's starting there because it's almost compassionate care. It may not be incorporating it every day the way I do now, but it's understanding that there may be other options. And if we look sometimes, we can find areas and people who have specialized in things. There are neuropathic situations that we use the alpha lipoic acid infusion, and it's after chemotherapy induced neuropathy or some other diabetic neuropathy. And some of these patients have settled. And of course, it's not always, but we have the more options we have, the way I see it, the more possibilities. So when we have more than one thyroid meds, when we have more than one antibiotic, if somebody is resistant to one form, then we have an option. Now, translation into drug development, I would say this whole, we have translated several plants that you may know into drugs. A lot with the periwinkle and the sea sponge came directly out of UE. Of course, Dr. Williams with his guinea hen weed. But I dare share with you that I'm going to give you a list in alphabetical order of many, many drugs. And I had a like 1900 Merck manual, which was showing how you standardized all the plans to get the medications. And our old pharmacists who were called chemists were fairly trained to do so. So here it shows the drug, the action, and the plant from which those drugs were derived. And so this whole field of plant medicine has been fueling our area of classical or conventional medicine and continues to do so, and is worthy of research and is worthy of continuous development. I want to kind of wrap up a little bit looking at palliative care. So I spoke briefly on compassionate uses, and a lot of people do cannabis, and there are IV vitamin therapy. When I started IV vitamin, the work was only in patients with gut disorders or who are completely NPO for extended periods. But we can use IV vitamin therapies in cancers, in autoimmunes, in a number of areas now. Um, of course, there's cultural and religious expression around many plants and emerging infections. Because the thing with emerging infections, it may be a while before a vaccine or some antidote comes of age. And the integrative medicine policies sometimes can help. And a lot of these have been around 500 years and have done hundreds of thousands of case studies. When I look at papaya, there is publication coming out of the government in India, Sri Lanka, and lots of parts of Southeast Asia, where they have confirmed the safety, they had confirmed the effectiveness, and they were using in hospital systems. And so when we had an outbreak, we could have pivoted on their knowledge. There was a plant called Eupatorium. It was in the old Materia Medica, which is like an old herbal text for this thing called breakbone fever. And then we realized that chikungunya meant breakbone fever. And I used it. And I would say I didn't even need to give them a second day. When I used it for chikungunya V, they never needed to finish the dose. It was almost an antidote. So there were things that we had. Of course, you don't have what shall I say, peer-reviewed, placebo-controlled, double-blind clinical trials, but we have hundreds of case series and patients who we can look at quality of life before and after. So it's I am so trained, so I feel comfortable understanding what can be used when and where. And I think if you are trained to use something, you understand how to use it, you understand how to dose it, you understand when not to use it. And that's the most important part. It's really getting the knowledge and then finding your comfort. It may be just around vitamin C, adding that to somebody with the flu or a B complex, but wherever it is, the more knowledge in the area, the more we can serve our patients. This is just a sort of look at, let's say, neuropathy. And it's just to say that we often look at the metabolic causes. So we check you for diabetes, and sometimes we don't see any, and we stop there. Most doctors now are pretty skilled with the B12 deficiency. I used to see a lot that were missed, but I feel so good now that most times we're checking that. We're checking the thyroid. But I want to remind you that there are a lot of, let's say, heavy metals, arsenic, lead, mercury. There are people with mercury poisoning, alcohol excess, and so on. And so, we always look at toxins, inflammatory neoplasm, the tin can medi model, but sometimes we don't really practice that way. So, in a workup that would be integrative, we would do the traditional causes. Let's say neuropathy, we're looking for diabetes and we're looking for thyroid and we're looking for the classic things. And then we would do a nutritional workup because we know that B12 can be an issue, B1, B6, copper, vitamin E deficiency. So we're also looking at the nutrients. We do a toxin workup and a great number of patients. I mean, Jamaica has a lot of heavy metals come up really, really high for toxins. We also look at psychological inquiries. And so the treatment would be a little bit more broad spectrum. We would treat whatever disease, glucose toxicity, metal toxicity. So we are trained in detoxification. Let's say if we find that it's a metal, it can be a general metal cleanse, or it can be a chelator for mercury, or a chelator for lead, or a chelator for arsenic. And we may decide to do so oral or IV. And then we have to be monitoring and we have to know dosages for the kidney and so on. But it's, the whole detox is fairly generic now, but the body is always detoxifying. And what we do is enhance it where necessary, providing binders. And we never detox without binders to make sure we have something to kind of cage that toxin. So it's not an afterthought. It's a whole skill set too. So I think natural remedies finds certain answers, but it definitely provides a little bit more options to treat. It may come across comprehensive if we're very holistic or integrative. It's always useful in chronic diseases, not usually in acute diseases, though. There are times, but not usually. So, my summary is that natural remedies are part of modern healthcare. They require research, they require further development, and preservation of this very, I would say, rich heritage that we have is of paramount importance. And training physicians helps to bridge the divide, and a culture of self care and preventative medicine is often fostered. So, like for me, I have a wellness wheel, and I always start with that before even going over into anything. And it has to do with their diet, and they're like, "Oh, I'm slacked off. Let me go back to that. Their hydration, their sleep, their anywhere that's inflamed." I found diabetics uncontrolled, and it was just a gum infection or a dental carie that needed to be sorted out. When it was sorted out, sugar is back. And stress management. And they're like, "Oh, yes, I'm stressed." And once those are in place, that foundation has to be built before, or has to be strong before we build anything on it, drug or otherwise. But natural medicine, natural remedies may also reduce health costs in some situations. And with that, I really want to thank you for your attention and allowing me to share. And I'd be very happy to discuss any questions that you may have.
Ah, Janice, Dr. Simmons Fisher, thank you so very much for
Pleasure.
um uh, for me consolidating a lot of what I know, but in for other persons um opening eyes to what else is there. In other words, the term I wrote down to help persons to expand their toolkit. hmm the product that you placed the lady on was Armour Thyroid. At that time, we used to have that, but we can talk about that at another time. There are a number of questions in the chat in the Q&A. The first one is from Charmaine Edwards. This therapy, this is when you were speaking about the stress therapy, stress management. Sounds a
Right.
lot like CBT. How do they relate? And is the way forward heading in the direction of including CBT routinely in chronic disease treatment?
I think once, let's say you have a model of auditing and you think that stress is a major component, then you could look at CBT. But cognitive behavior therapy is just one model, and
Yes.
there are several others. There is color therapy, there is aromatherapy, there is light therapy, there is massage therapy, what you use for stress management. And the truth is, we help the patient to build a protocol. Because a lot of times it happens by chance. You ask, "What do you do for relaxation?" "Oh, I watch Netflix." And we don't even know if they're watching something traumatic or something that is triggering a relaxation response. And we don't know if they know either. And so it's understanding the things that create stress and how they manage that, understanding the things that bring them bliss and allows them to get into a relaxed state, and how we incorporate that. Because we're always looking for this sense of, I would say, relaxation. It's like how we say energy is ground seeking. And I think it spurs why there is, alcohol addictions and drug addictions. People are trying to get the edge off, the stress off, sex addiction, anything that can help us to release dopamine. And none of them are bad inherently, but they may get to a place that we don't have control. So we are not in the middle of Times Square and there's an earthquake, we should be able to, have something internally that we can use to maintain our composure or to get some poise. And it is in developing those relaxation, those skills. It could be meditation, it could be devotion. But I can be on a massage bed and I'm working out my, how to say, my grocery list, what I have to do later.
Yes, that's true.
Absolutely no stress response. I could be in meditation and my mind has gone on what I need to do next week and if I can find this in time. And so it's not an intellectual exercise. It's an emotional center. It's an emotional release of specific hormones, and you can be trained to trigger it. There are what I prefer, like as a tool now, are these AI headsets, and it can bring you to a place where you're walking in the garden, you're looking around. If I'm on a bridge, I may feel like I'm falling. I don't think I'm in my office or in my chair, and I can see my brain waves. And if I'm listening to, let's say, the ocean, I can watch my brain waves change
Mm-hmm.
form. So those are some tools, and they may work, but a variety of things. Some patients are not yet ready for talk therapies, but it should be that depending on what the stressor is, that they build a system to improve their emotional resilience, but to also have some non-negotiable me time that is part of their stress management, whether it is their exercise time or a massage a month or a weekend once a year, but it's not happening by accident, and it is that they are getting this emotional release that the body is seeking, and not because, like with the brain, there's a lot of toxicity when there isn't enough sleep, and when there is this high level of stress, there's a lot of brain cells that die. So we
Yes.
want to preserve health.
That is so true. And just speaking about stress itself deserves its own seminar, I should say.
True.
And the stress response. No, another question from Yashika Palmer. What do you think would help to improve coverage of nutrition and chem therapy from medical school level?
Coverage from medical
Yeah.
school level or for patients.
Well, this
Um,
is also a medical school level. Uh-huh.
uh, is,
Uh,
tell me what you understand from the question, Doc,
well,
because I'm
well,
thinking,
this person may be wondering what could be done from, let us say, an undergraduate level. And maybe I could answer for you what is
yes.
happening now at UA, from about the third year medical students. They do have a lecture on complementary and al alternative medicine. I used to do the lectures, I know. And after graduation, for those persons who join the family medicine program, there is actually a module which many of what you have spoken about um, would be covered in the module. So that may answer that question there. Uh-huh. So the next one is from Ashley Lewis Knight. Excellent, excellent presentation. Where would you send testing for toxins and also for mold?
A lot of my testing is overseas, unfortunately. I'm not so familiar, but there are so many integrative labs in the US, and
Yes.
most of the labs and a lot of the supplement companies allow that. I've also used IGL in Germany, I've used Acumen Lab in London. So a lot of the extensive ones, we can look at even adducts to DNA, adducts on genes, things that are turning off, or anything that is way in excess that the white cells are responding to. But there is a company locally that will come into the home and will test the house and look at your spore count for mold. They're not looking at it in the blood, but they are doing air sampling,
Yes, sampling.
and they will be able to kind of direct you to remediation measures. Um, But yeah, we don't do a lot of heavy metals here. A lot of the heavy metals need challenge testing where you have to mobilize with something like EDT because it's stored
Yes.
away in liver and blood. But you can look at hair samples and stool and so on. So it's a lot of the integrated things are perhaps overseas, just like
Yes,
a
are
lot of
overseas.
our vitamins are brought in from
Hmm.
overseas or IV
Overseas.
vitamins.
Uh-huh. The next one is how can you be contacted? You could probably type that answer into the
Yeah,
Q&A.
sure.
Yes, uh-huh. And from Ashley Lewis Knight, excellent presentation. Wondering if you have any success stories with treating psychotic or mood disorders.
Um,
Ah,
I would say yes, although it is not my bread and butter. There are integrative models, especially, let's say, mood disorders like depression and anxiety, more the neuroses than the psychoses. But there are psychoses associated with toxicity. There are psychoses associated with deficiencies of phospholipids in the brain and nutritional things like plasmalogens, which are better controlled once those things are addressed. Does that make sense?
okay. Yes, uh-huh. So, from Dana, Ashley Abrahams, as it relates to the natural remedies prescribed for different medical conditions, how do you arrive at the dosages and what resources can be used for same?
So everything, just like metformin and Cipro and azithromycin, has dosages established. It's kind of, I would say, so I do a lot more with nutrients, and sometimes it is RD, sometimes it's several times RD. Like vitamin C, RD is 60, and nobody does that. You go to the store, it's 500 or 1,000. And when we do IVs, we may do several thousands. But there are courses, I would say the American College for the Advancement in Medicine, ACAM, there is A4M, which is the American Association of Anti-Aging Medicine. There are functional medicine seminars, and they may explore one thing: weight loss, female hormones, skin health, and they may go into the nutrients and the dosages. But it is so many different things. If you're taking ashwagandha, if you're taking this, that, but they all come with dosages. And in studying them, you really have to be able to speak to the dose. And just like, with my stem cell work, there are a lot of orthopedic surgeons who are doing stem cells at surgery, and surgery, they always give pain meds. And when you block inflammation, you block repair. And so the patient, I would ask, they say, oh, I did PRP, it did nothing for me. And I said, what happened after? She said, I saw her, took Brufen. And I'd be like, so why would it work? Because the process is what you do before, what you do after, what you do during. And it's understanding that repair system. And I always say natural medicine isn't just taking some herbs. It's a whole system of what you eat, how
Yes.
you sleep, what your wellness practices are. So you're not going to be having all sort of burger and sugars and just pop some pill, and it's going to be effective. And sometimes that may just come across that's not really making any help for them. And when you just start with the basics, with their hydration, with their stress management, with their
Mhm.
sleep, you may find that you get more than even adding a supplement. But supplements are particularly useful, and I use them every day. Lots of physicians, probably Dr. Jackie still uses every day. We do a little magnesium, we do a little this, and we are
Yes.
able to
My
help
favorite
sleep.
mineral.
We're able to help sleep, or we're able to help some
Yeah.
stress. So it's, magnesium and so on, we can look up easily, but it is that the courses help. And you can
Yes.
start small and build up if there is a genuine interest.
Evening,
Uh,
docs. Okay, perfect. We have 13 questions left, and you have eight
w-
minutes. So,
Wow.
wow.
so please, let's try and Because it's an amazing
No.
Okay,
conversation. Let's
so
see if we
One
can go through
one
them
word
quickly.
answers.
okay,
Let's go
well,
through them quick.
okay, let us go. Let us go. Could you speak on alternative remedies that could be used for patients with kidney disease or kidney stones, please?
Yeah,
Ah,
I would say I put myself there. WhatsApp me. I do have a lot of things that I use for kidney disease, and I do get
mm-hmm.
excellent results in
Excellent.
reversing a number of things.
Yes, I know of that one. Uh-huh. No, from Dr. Maurice Guy. Can Dr. Fisher speak more to the psychological conditions that lead to peripheral neuropathy?
Oh,
Uh,
I don't know that the psychological condition leads to it, but that what appears to be neuropathy is a psychological situation. So it's sort of
oh,
like where you can have crawling when you're, let's say, a cocaine addict. You
the
can have
formication,
issues
yes,
with the
yeah,
brain. You can
yeah.
have a brain issue that may express itself as seeing things, feeling things, or appreciating a neuropathy. So what you're seeing isn't diabetes, it's actually a psychological illness.
Okay, so it's a question of sort of disaggregating there. All right. So
Right.
the next one, you had mentioned the study out of India and the resultant use of natural remedies in the hospital setting. Can you comment on research of the therapeutic benefits of bush medicine in the Caribbean, how to induce government funding, and how to source private foreign funding when most R&D look to bottle and monetize plants rather than facilitate education and access for the average citizen? That's
It's
not
a
a one-liner
really big question, yeah.
response.
And I think like Lawrence Williams with the
Excellent.
guinea hen weed, but
Yes.
it is not as easy. But there are when once you've gotten to a certain point of establishing effectiveness, and once you can create a unique molecule that still holds a therapeutic effect, then you can engender research. And a lot of plants in Jamaica have been, taken on by Germans, and they have completed clinical trials with it. But I think in an established setting like UE, where so many plants are analyzed and you can do the bench science and then move on to bedside science, then you get to really look at it. But I think it has to be in sort of an academic setting where you can
Yes.
establish
Uh-huh.
this.
Okay. There are a number of questions, Janice, that you're going to probably have to answer outside
One
of
or
the,
two.
yes, one or two. Yeah. Yes, it's an interesting one. What are the integrative approaches to manage obesity? Please share your experiences. Wow.
So, I mean, that is a big one and it's not a hard one. Well,
Mhm.
so I do obesity and I do GLP ones, I do Monjaro, I do Ozempic, I do diet, I do exercise. So you may look at, let's say, diet, and sometimes I do a metabolic breath analysis that can look, and I can look at nutrient profiles and look at what nutrients maybe the person's deficient in. And sometimes it makes them go in starvation mode. They're not burning fat because they're micronutrient deficiencies. Sometimes they're not detoxing well. And because of that, the body won't burn fat because it hosts a ton of toxins that it can't process. And so we look at the diet very, very carefully. We look at macro and micronutrients. We may look at their exercise if they can do it, but we can also look at exercise zones. And we have testing that we can look at what your particular zone 2 or zone 3 or zone 4 and what is necessary for you to optimize metabolism. So we're doing metabolism testing similar to what would be done in a physio lab. We have an in-body scan, which is similar to a DEXA. So we can look at compartmentalizing the body. And so we can know your percentage body fat, muscle, bone. And if you are losing weight, whether it's coming from the fat or coming from the muscle, and if it's from muscle, what are the strategies to improve branch chain amino acids and so on, preserve muscle mass and have fat burning, And so it is also looking at inflammation, making sure you're absorbing nutrients in the gut, looking at stress management. Some people won't lose weight until we control their cortisol levels.
Yes. Uh-huh.
Looking at sleep, which triggers a stress response. And of course, looking at ways of improving insulin resistance, whether it's berberine or GLPs or something else. But it is the same model, it's just expanding, really expanding the diet, really expanding the really expanding the exercise, because you can be burning and just, I mean, exercising and just emptying your carb stores. And so, after 48 hours, the body stores carbs for 48 hours, and we can empty it and then we carb load and put it back, and we're not burning any fat. So, fat burning is a zone two situation. And if I say, for you, Jackie, zone two is 92 to 98 for a heart rate, I want you to exercise at 92 to 98 heart rate, look at your watch or whatever for 45 minutes, then we can see. And sometimes it's optimizing mitochondrial efficiency to improve fat burning. So that integrative model is very well sort of established, and it's doing all the things that you are doing now, but with a little bit more precision and measuring, because the exercise is, there are people who are inflamed that we wouldn't give a lot of aerobic. We want to calm that inflammation down and do more stretching. So it's
All
getting
right.
the science behind that.
And utilizing it effectively. Um, Dr. Cargill, Sam, we have how many minutes? 6 minutes left?
Or
Uh, we'll work with it. If I could interrupt, I think a
Yes.
question that I could probably merge. Do you have any
Uh-huh.
successes with curing or treating Alzheimer's and autism, as well as PCOS? So two different questions. One person is asking about PCOS, another person is asking about Alzheimer's and autism.
And the answer is yes, but it's not all the time in everybody. But I would say it's 60% to, let's say, with the dementia cases, we do from peptides all the way to stem cell growth factors. And most times we're able to preserve and we can increase a little bit of the situation. With autism, it's much about the same. It improves on what, as Dr. Jackie says, it's expanding your toolkit. So you have one thing and it brings you from a two to a four. You may use something else to bring you from a four to a six. And it doesn't mean that you have full success every time, but it means you have more success overall than you would without as many tools. So the answer is yes. The answer is yes. And there are lots of things to discuss and lots of things to share that are fairly individualized. Because the truth about it, it's that it's not a sweeping stroke. It's a very delicate, tiny things that are individualized for each patient based on measurements and biochemical testing and so on.
All right. We're on to 1 more minute, Sam.
Yeah, I think we can take
Okay.
one
And we're
more question.
stretching
One more,
it.
one more question, because you have so many questions coming in and they're
That's
quite
fine.
interesting questions. No, Dr. Cargill wants to know, should medicinal herbs be dried and steeped in boiled water in a non-metal container versus boiled in a metal container? I once heard that neem should not be ingested, but used topically. However, I've seen patients saying they drink neem tea for different ailments. That's a
Yeah,
question
again,
comment.
there are specific ones. So the thing with most leaves, it's a tea and infusion, and it can be in metal. There are some things, let us say it is a teaspoon to a cup most times. So it's a lot of Jamaicans will take, let's say, Cersei, and they will take 40 times the dose, and then they will boil. And sometimes in this excess heat, you will bring out these parasolidine or these alkaloids that can be very stressful on the liver. And then there are some herbs that are cold infusion only, and there are some things that we don't do in a metal container. I can think of one plant that we only do in glass, but for the majority, metals are fine. But most times you can take a teaspoon to a cup and just allow it to draw for 10 to 15 minutes and you're fine.
You're fine with that. And the final one, let me see now. Oh, wow. I have encountered from Dolores Corbin. I've encountered elevated LFTs with persons using soursop leaves. Is there any benefit of soursop in chronic illness?
I mean,
Ah,
soursop has had a lot of research. I'm trying to remember the name of the plant extracts, and they were particularly useful in colon cancers. But again, remember, if you take a handful of Panadol, you might be dead. And so everything, the only difference between the drug and the poison is dose. So everything that is a drug is potentially a poison. A chemotherapeutic or just something that we give a baby when they're just born. So somebody may be using it and they may be boiling and they may be using more than a teaspoon and they may be doing a number of other practices that are stressing the liver, just like if you take 10 times the dose of a drug. So it's important to understand that it comes back down to dose, the
yes.
frequency of use, and the state of the system that it's being ingested in. But it has these particular, and it's just evading me now. It's in
Asita Jennings, Dr.
acetogen.
Jennings, Dr. Garwood
Yes.
gave you the, the,
Thank
the
you, thank you, David Asita Jennings. So yeah,
uh-huh.
it is well studied, and it reached the point of almost becoming a drug. But whenever they changed it to create a new molecules, because you can't get a patent on something natural, so they would have to alter it. It wouldn't maintain its effectiveness. So that one has a number of effective uses, and I believe that. Um, yeah, it can benefit many. Sometimes they just need to stop for a while and figure out if it is the draw, if it is the plant, and then to use it judiciously.
Wow. You have a number of questions left, so I'm going to ask you to
Answer them in the
respond
chat. I can
in the chat,
respond.
yes,
Thank
from
you.
Dr. Goodall, Brown, Morgan, and Williams Green. So please answer
Okay.
in the chat. But thanks
Thank
again
you.
for an
Thank you.
eye-opening, very informative um, presentation, leaving us with many questions. And so the conversation has to continue, and we, look forward to hearing more from you as time goes by. Thanks again, Dr.
My
Simmons
pleasure.
Fisher.
My pleasure.
Oh, wow. Sam, our next presenter, please. Our
Yes, on to our
great
next presenter.
presentation. Yes, uh-huh.
Yes. Um,
Is Dr. Daly on?
yep, Dr. Daly's here and ready. Was waiting on your introduction.
Okay, then. And I just need just to have a So our next presenter is Dr. Denise Daly. She is a pharmacognosist and with over 15 years experience in research and over 10 years experience in academia. She's a graduate of the University of the West Indies, where she studied biochemistry, specializing in diabetes and hypertension and plant pharmacognosy research. At the University of Manitoba, Canada, she studied human nutritional sciences, working as a teaching assistant and conducted clinical nutrition and functional food research. Her research career, very interesting, involves isolating and elucidating bioactive compounds from medicinal plants. Um, and food in order to bring findings from bench to market. Dr. Daly has experience in translational research where she formulates functional food. nutraceuticals, and cosmeceutical products for health and wellness throughout her career. Very, very interesting bio here. Dr. Daly has received several awards throughout her career, and she has written many research papers, book chapters, abstracts, posters on various aspects of her work and other medicinal plants. So Dr. Denise Daly is quite competent and to deliver our next presentation, Herbal Remedies in Integrative Medicine. Dr. Daly, welcome.
Thank you so much. Thank you. And good evening, everyone. Thanks so much for having me. Well, today we want to talk about herbal remedies in integrative medicine. And what does that entail? And how can we move forward with that as well? Okay. So the objectives, we'll be looking at a little of the traditional uses of herbal medicine. We'll definitely get into pharmacognosy and evidence-based applications of our medicinal plants. We'll look at some remedies that have been used over the centuries in different locations and what's next. How can we move forward with some of the herbs? Are they safe? And what do we do as healthcare professionals, as research persons, to ensure that the population and health can be established using some of our herbs? This is a little bit about my work. We've just heard that in the introduction. So I'll skip to a quick trivia, and I'd love to hear or to see in the chat, do you know some of our medicinal plant treasures? So I'd love to hear, let's go back a bit. Any of these plants, do they look familiar to you? I'd love to. All right, aloe vera, turmeric. Yes, A is turmeric. I'm seeing ginger. That is true. Ginger is B. Turmeric and neem. Yes, D is neem. Noni, not here yet. Moringa is
Moringa,
definitely C.
yes.
Yes. And yeah,
Leaf of
we've covered
life.
leaf of life. That's the one that was not covered yet. How about, let's go a little, maybe not so familiar, but still our medicinal treasures. What about these plants? Do they look familiar? H is marijuana, definitely. Garlic, yes, Elizur garlic. We have bird pepper. So we know our medicinal plants. Lignum vitae, pepper elder, great, perfect. There it is, lignum vitae. So we have quite a few medicinal plants. Some are more common than others, and some are more popularly used in locations where they're planted more, they're more available. So what exactly are medicinal plants? Now, these are plants or any part of the plants that have some therapeutic value. You can also have that pharmacological effect on humans or on animals. So you have a lot of research being done with these plants. They're used in traditional medicine for over 3,000 years. So we have the traditional African medicine, you have Ayurveda, traditional Indian medicine, we have traditional Chinese medicine, and you can go across the board. So almost every ethnic group use medicinal plants as a part of their therapies. It is the basis for all ethnomedicinal practices. When you look at ethnobotany research, horticultural therapy, just doing some gardening, it's also being in the presence of your medicinal plants. Today, 2025, we still have 80% of the world utilizing medicinal plants. And there are various reasons. And if it was a little more interactive, or we can talk about, you can put it in the chat. Why are we having so many persons still today using medicinal plants as their first source of medicine? Oftentimes it's accessibility. That's what they have closest. That's the tradition they have been working with as well. So why are we using plants? Why use plants as medicine? So plants contain phytochemicals. We know these phytochemicals, as the name suggests, are compounds that the plants produce. These compounds are really made for the plants. So the plants are trying to take care of themselves. These have a function of defense, pollination, they are insecticidal, they're to ward off predators, etc. A plethora of responses why the plant is producing these chemicals. Now, these same chemicals have been shown to have therapeutic effects. Now, with that, as a researcher, we look at how can we then use these benefits to our advantage, to our health and for our food. And that gives rise to therapeutic research or formulating products from these plants, such as nutraceuticals, or continuing on to do pharmaceutical research. In fact, a lot of these phytochemical compounds have been the template or precursors to making synthetic drug or pharmaceuticals. Now, we have a lot of plants that we'll classify as medicinal, some of which we mentioned prior. We also use plants for food. We know of the process of photosynthesis and grabbing the energy from the sun, making your glucose, and in essence, all food is grass. That's one of the philosophical questions they always say. What does that mean? All food comes from plants. And therefore, if you look at all the varieties of food, it all goes towards the food chain and where it falls in the food chain. Where does it then fall in the food manufacturing or food supply system? So as a result, if we can start utilizing more of our plants as food, we can see a lot more changes as the structure of our organic plants and vegetables, fruits, etc., are so intertwined with our system as well. So there's definitely a role for herbs in health and nutrition. So when we refer to herbs, we're really referring to whether it's the leaf, the flower, the stem of the plant, and we use it for flavoring, we use it for garnish. So oftentimes when you're going to cook, you have different herbs that you'll start to put together. Your basil, your chive, your marjoram, your onion, your garlic. These are all herbs that we'll use to cook, but they are also very medicinal. Spices, when we refer to spices, these are like your seeds, your fruits, your bark, and for example, your paprika, or you have your ginger powder, your turmeric powder. These are examples of some of your spices as well. So how do we then combine that knowledge that we have with our medicinal plants and our health? How can we make it integrative? We want to move towards having a more holistic approach to wellness. When we talk about holistic health, this is looking at the entire person, their physical, their mental, emotional, social, the entire person. And as such, what are some of the practices are we going to put in place to help to institute a holistic health? So holistic medicine is described as a form of integrative medicine. So you're combining both the conventional medicine or conventional practices along with alternative practices. How can we get our clients or patients at their best health? Part of getting to that evidence-based approach is pharmacognosy. With pharmacognosy, it's the basis on which you would start the drug discovery process. So it's a discipline that looks at extracting, isolating, finding the bioactives in our natural products, natural components, natural resources. Now, I specifically look at plants. So plant pharmacognosy, that is my specialty. So I mainly look at how can we extract the medicinal compounds from plants. We want those phytochemicals, the plants use it, we observe our animals. How can we then form new templates? How can we get new precursors to help with healing and getting more prescription? So pharmacognosy is a significant portion or a significant part in the drug discovery process. And plants are a template, and it gives that idea of where can we go? What can we do? how can we modify this compound that has been extracted? And I give you an example of extraction and pharmacognosy. When we have different medicinal plants, we will get that knowledge from either forefathers, from traditional medicine, your great-grandmother, your grandfather, auntie, uncle, or just elders in the community. With that knowledge, does it really work? In the era of industrialization, once we started having equipment, we were now able to extract. So a lot of the extraction started in the late 1800s, early 1900s, when we start having the UPLC, HPLC, and of course, progression. The more we progress with technology, the more we can isolate, the more we can elucidate structures, the more we can do biopurification and find out, do these plants work? And if they do, what is the compound in it that works? So this brings us to finding toxic compounds, complex structures, templates for new drug. And one example I have here, I'd love to see in the chat, do you know this plant? The periwinkle plant. Periwinkle is so common across the Caribbean, across the diaspora, and it is such a medicinal plant. And as we've said earlier, and Dr. Janice said, there's a thin line between medicine and toxin. Now, the periwinkle plant, as a medicinal plant, you can get the mature leaves, and with extraction, you can isolate the compound, the vinca alkaloids, we call the active anti-cancer compound vincristine, that have been formulated into a drug, and that is now used in anti-cancer therapy. There's so many vinca alkaloids today because once we've then isolated that one vinca compound, you can then modify the structure. And that's the beauty of science and nature. Once you do the extraction from your original idea, you can make the changes to enhance the potency, to reduce the side effects, etc., etc. And with that, we have more drugs being formed. Today, we still have 25% of drugs being from plant extracts. And guess what? You have so many plants that still need research to be done, that still need to be validated scientifically based on their traditional uses. In fact, only 15% have been validated. And Jamaica has approximately 50% of all the medicinal plants already identified as medicinal plants. So we on the island of Jamaica have a treasure of having endemics and indigenous plants, especially within the Caribbean and the diaspora. In the tropics, we have a lot of resources that we can utilize for health and wellness, but we have to ensure that we're doing it safely, because again, there's a thin line between medicine and toxin. But how do we know? How do you know where to start, what to do? Where is the basis of the research going to be? Where is it going to start? If we think of traditional medicine, we think of oral tradition. How did you first drink some ginger tea? Your mother, your father, some parent or grandparent. So humans have been using oral tradition to pass on knowledge about plants, how to use them, and what to do. Again, we have this folk song we usually do. Mary, is it Mary? Boil Cersei. Yeah, boil Cersei for her belly, right? And her mother said, I can't even remember the song. If somebody know the song, they can remind me. Helena got a ball for her belly. And Helena, yes, thank you. Helena ball for her belly, and mommy said, go home, Helena, go boil Cersei for your belly. But luckily, before mommy reached and look in the pot, Helena was boiling a completely different bush. And Helena mother say, so Helena, from your born, you know Cersei? That is a critical point. Because again, if you know boil Cersei, a poison you boil for your belly, and so on. That tradition was passed on. What to pick, how to pick it, how to prepare it, how much to drink. And that's the difference between that toxic effect and that medicinal effects that we can have with our plants. When we look at getting the ideas of how to use the plants, our forefathers observed how the plant looked, from the fruit to the leaf to the flowers. If you think of lugwort, if you think of Atropa belladonna, and all these plants. We're going to look at a few examples of fruits, vegetables, and nuts, and even foods that we eat in our everyday life. Our forefathers used them traditionally for some of these ailments, and then science is now validating that, hey, this is a compound that causes this effect. What does that mean? What is it called? We call that the doctrine of signatures. Now, they say it's really, look at how the plant looks. It gives an idea of how nature intends it to help heal the body. So medicinal plants were discovered by trial and error. And traditionally, that's how they'd pass it down to generations. And as scientists, we then validate some of these traditional uses. But mind you, although we're validating it into the lab, there's so many case studies, clinical trials. We call them clinical trials in the scientific world, but in the traditional medicine world, they have cases upon cases that validate their traditional therapies. If you think of the traditional Chinese medicine, they have existed for over 5,000 years, treating cases, whether it's diabetes, whether it's cancer, whether it's epilepsy. They have the different regimes that they do. The Ayurvedic medicine do as well. And all these medicine put together, if you have different alternatives that persons can use and utilize based on scientific validation and how to use them for safety, then we can have a healthier society and less chronic lifestyle diseases. So the doctrine of signatures is also called the doctrine of similitude, because it tells you, or it claims that if the plant displays a characteristic or a signature, whether it's the color, shape, etc., then it will help or indicate that this is how it can help the body. Now, through that, a lot of compounds have been discovered and a lot of therapeutic effects have been discovered. Now, this is a quick diagram showing a lot of different foods, how they look, and does science validate some of their uses. So far, a lot of these plants here, and these are all foods, have been validated through science. Does tomato really help the heart? Yes, because tomato has a high concentration of lycopene. You have your citrus and helping the breast. You have the carrots. When you cut it, the cross section of your carrot, it looks like the eyes. What do we say about ensuring that we have enough carrots? We want that beta carotene. We want to improve our rods and cones and ensure that our visions are better. These are some of the things that nature has intended. We have the same molecular makeup, and we have similar biochemistry and structures and mechanism and metabolism that's going through. And as such, we have a lot of natural resources that we can use to enhance our own life. Is it true? Again, we have the technology to check. We have the technology to get more evidence-based results. This is an example of some work done with ginkgo biloba. Now, ginkgo biloba is a popular supplement. It's a popular tea or powder. You can get it in many forms. Now, if you look closely at the leaf of ginkgo biloba, what does it resemble? I'd love to see.
Brain.
It resembles the brain. So if you turn it, you're seeing the cerebellum, the medulla oblongata, etc. Just turn it and you see ginkgo biloba resembling the brain. Traditionally, ginkgo has been used for that. They'll make the tea, they'll add it to tinctures, apothecaries, etc. to help with cognitive issues. We now have technology. What are the compounds in the ginkgo biloba? You have your bilobalide, you have quercetin, your camphorol. All these compounds have shown therapeutic effects. And this is how we, stage by stage, we validate some of our medicinal plants. So these compounds with the ginkgo, how does it help the body? Validated research, it does improve the memory. It does enhance neural plasticity, improve cognitive repair, preserve brain receptors, and you name it. This is just a few research that have validated the use of ginkgo biloba. Overall, we could look at a lot of herbs and spices, and we're going to a few of the plants that we spoke about before, but just the class of polyphenols from our plants or medicinal plants have been shown or proven to have so many therapeutic effects. They're anti-inflammatory, antioxidant, antimicrobial, prebiotic effects. Now, all these research have shown to help modulate gut microbiome. With that, you have the benefit of your good bacteria getting rid of or reducing those of your pathogenic microbes. When we have a balanced microbiome, that also helps with ensuring proper signaling. And as a result, better health, better regulation, better metabolism. Where is the source? What is the source of a lot of our polyphenols? Your fruits, your vegetables, your whole grains, and your medicinal plants. However, if we go to a client or a patient and you say, you know what, you can have your bilobadides and your camphorols and you can have your quercetins, they'll ask, what is that? So oftentimes you'll hear for every system, you have different medicinal plants that have shown therapeutic effects, from anti-inflammatory to even antioxidants. So you'll recommend or you'll say, you can have some nettle tea. Nettle helps to enhance the health of the kidneys. Stone breaker, in Jamaica we call it stone crusher, or it's a philanthus. Philanthus is the genus of the stone breaker plant. Very good with kidney stones. It literally calls it stone breaker or stone crusher or stone breaker because it breaks up the stones within the kidneys. The oxalates, everything, it removes it from the kidneys. And that's research shown as well. Horsetail, dandelion, extensively researched. So that's where the recommendations would come in saying, these are some plants, research proven, evidence-based. Oftentimes, again, you will have different levels of research being done with some of these plants to validate for particular organs and particular biochemical pathways. You can sometimes turn or direct clients or patients right back to their food. How is your nutrition? How are you maintaining your health? How are you? Oftentimes you're getting enough energy, but what about the other parts of the body, your micronutrients? So if not just some herbal tea, you can talk about smoothie blends, juice blends, having your carrot and beetroot blend. Growing up, it was a staple on Sunday to have some carrot and beetroot. Why? Our grandparents just told us it's good for your blood. Now, science is showing us why it's good for the blood. And of course, if you add some cucumber, female reproductive system, rejuvenating and helping the hormone function. It provides so many micronutrients. When you talk about the mineral profile, you talk about the phytochemical, the phytonutrient profile. Significant amounts have been isolated, especially when they are combined. Beetroot alone has anti-proliferative effects, antiviral effects, and anti-inflammatory effects. Carrot alone has so many polyacetylines. It has a natural ascorbic acid, which has been shown to be so therapeutic. It's like the staple for antioxidant effect. But medicinally, it helps to reduce cancer. It helps with cardiovascular disease. And that's just by improving your diet and enhancing your diet, ensuring that you have the different colors. Because every color that your food produces is a different phytochemical that can help your body. It's a different medicinal compound that can help your body. So if you think about your reds, you have your anthocyanins, example, lycopene. The yellow or your orange, your beta carotenes, that you have so many carotenoids. Green, your polyphenols, your tannins, your chlorophylls, isolated and show bioactive effects. And what we find with our food, it's packaged in a way where, for example, if you're having your carrot, you need vitamin E or you need a fat source to help increase the bioavailability of your beta carotene to ensure that it enters the blood. And carrot itself comes with that package. Our food can help to induce change in our body. And we see it. We see how changes in the food manufacturing, the food production system, the fast food industry, etc., have changed the way our health, our life, and our diet has been. And we see where we're now promoting that change to know a more holistic diet, because food can be a healing agent. It can be a part of the therapy. And that's what we're hoping that more practitioners can move towards. Let's use food as a part of our recommendations with each patient, with each client, because those phytonutrients, those phytochemicals, when we combine them, you're getting your allyl methyl trisulfides, right? Those are your sulforaphanes that's in your onion, your scallion, your garlic, those strong scents. These are natural detoxing carcinogens, and you're just making a stir fry. When we look at them in their powdered form, yes, you have them in the pharmacies, yes, you have them in the stores, but you also have them in the market. So you can start looking at your plate and enhancing how you put together your food, what you eat, and how can you use food as a healing agent. As Hippocrates says, let your food be your medicine, your food. That's also in the Bible. Every ethnic group that uses natural medicine also promote food as a part of the healing journey. How does cooking your food affect your food? It does play a significant role. And as a nutrition consultant, a nutritionist, and a scientist, looking at the changes food go through when we cook it, again, are we just cooking it for nutrients, or do we want some of the medicinal value? Some nutrients are destroyed with heat and with sunlight, etc. They're very volatile. Same with some of our medicinal compounds. In fact, the heat, the pH, food colors, vitamins, and minerals can be either enhanced or destroyed by how we cook it. One example I have here is broccoli. So broccoli, we can have it raw, we can have it cooked. When you have broccoli raw, overall, it helps with naturally enhancing the liver's function by increasing its detoxifying effect. So it helps to clean the blood quicker, break down those harmful chemicals, send them to the kidney as even better, working more efficiently. Now, research was done where the NRF1, it plays a role in controlling the basal gene expression, right, of the cytoprotective enzymes. And with that, when you cook your broccoli, just a little toss, when that bright green comes up, it increases the expression, it increases the function of your nerve enzyme, which means it increases the detoxification value or ability. Now, when you overcook your broccoli, they realize that the activity level significantly decreases. So that soft, mushy broccoli, no, you're just getting nutrients from that. You're actually losing some of your nutrients when you overcook your vegetables. And I remember my grandmother growing up, she would say, the cabbage must crunch. If it not crunch, it not cook good. You overcook it. And then science is showing us how you cook your food also enhances the nutritional value, but also the medicinal value you can get from your food. Sometimes it does nothing to change that value. For example, tomato, in any of its form, you still have your lycopene. Whether it's ketchup, to a fresh tomato, you still have lycopene as a medicinal compound that you can have with your meals. So how can we focus on prevention? How can we use our plants to help us cleanse, restore, sustain, and build the body? We have to move towards integrative health, integrative medicine, using some of our herbs and spices and helping our bodies to heal. I'll give a few examples of herbs. Rosemary, it's a great tea. It's good for the skin. It's good for the hair, but it's also great when you're making soups or stir fries or cooking anything. Rosmarinic acid, eucalyptus, those strong scents are all medicinal compounds, research proven. It has that astringent effect that helps to reduce discharge from mucous membranes. It's a diuretic. It's also a nervine. It helps to induce sleep. So if you're restless, have insomnia, you can also have some rosemary tea. Just a few leaves in a cup of water, you can drink it. Or you can toss it in some stir fry or with your meats or vegetables. And it gives it that flavor, but also has medicinal value. It's been used for centuries. It is known as a natural antibacterial compound or plant, and it helps with bloating as well. Along with the rosemary, eucalyptus, a lot of these plants with high essential oils were often used in the hospitals. They'll just get the plants, put them in the hospitals, and it helps to not only clean the air. So it would clean the air, but it also calmed the patients that were there while they're going through their treatment regime. This plant, bushmint, Mentha saccharidois, is a plant that's used in Jamaica and in the diaspora as pennyroyal. It helps with menstrual cramp, infertility. So you'll hear different remedies combining pennyroyal, your vervine, with your marigold, and it helps with fibroids, and it helps with PCOS, and it helps with so many different issues, whether it's too much discharge, etc. When you look at how the plants are used traditionally, the elders always pass down how much, how you use it, and what you would do. Externally, it's used as a repellent as well. And it's a contraceptive and an abortive. So it helps to promote fertility. But again, if you're already pregnant, you would avoid having this plant because you can have a miscarriage. So again, the knowledge that will pass down, we have to start cementing these, and that's how we get validation of a lot of our medicinal plants. Oregano, we also have Spanish oregano or your French thyme, very high in essential oils, again with rosmarinic acid. It also has thymol, so it often reminds you of thyme that we would use to cook. These compounds reduce oxidative stress, which is linked to all of our chronic lifestyle diseases. And we know the antimicrobial properties of thymol and carvacrol, which increase the production of your white blood cells and increase metabolism. These help with a lot of ailments, and we can just, again, add it to our meal prep. What about moringa? It's amazing when this research was done, and it was done in so many different areas and then replicated in so many labs. Moringa leaves and seeds, the entire part of the moringa plant is edible. 7 times more biotin than eggs, 15 times more than potassium than bananas. And there's so many advantages and so many different concentration differences we're seeing with some of the nutrients. So moringa in itself is a natural multivitamin, but not just a natural multivitamin. I always say this is one of my favorite medicinal plants because it's not just a multivitamin, but a multi-nutrient. When we look at the phytochemical profile of moringa, you can look at the leaves, you can look at the seeds, you look at the bark, look at the flowers, look at the oil, the constituents of the plant. It's almost as if it's able to help with all the different processes within the body. You need minerals, it provides minerals. You need vitamins, it provides the vitamins. You need your essential amino acid, it's a source. Non-essential amino acid, it's a source. Antioxidant compound, a plethora. So as a multi-nutrient, you should be having some moringa tea. If you're not allergic to plants within the moringa family, it should be a part of your natural regime, similar to your mint tea and your ginger tea. There are a few other plants, excuse me, that have been extensively researched. For example, Guinean weed, that's one of the major plants that we've done in Jamaica as well, with duck and with guinea hen, called different names across the diaspora, but at the end of the day, Petiveria alliaceae is a potent medicinal plant. It is so therapeutic. In fact, Jamaica guinea hen weed, the concentration in our Jamaican plant of the DTS is significantly more than the Petiveria in other regions of the world when it comes to isolating and measuring, getting the yield from your guinea hen weed. So we do have a good foundation for making medicinal plants there in Jamaica and in the Caribbean within the tropics. Guinea hen weed or Petiveria has a sulfur compound, and that's why you have that strong garlic smell, and that's why it's so potent. So I would often say with guinea hen weed, if you have a guinea hen weed tea once or twice, then you'll rest. Allow it to help enhance the function in the body, but you don't want to drink too much. DTS, more concentrated in the roots of the plant. Proven anti-cancer compound based on its effectiveness, breast cancer, prostate cancer, leukemia, quite a few cancer cell lines have been looked at, and quite a few functional foods, not functional foods, but more, functional foods like drink and tonics have been made with your guinea hen weed, and persons have seen changes, especially with the prostate, men and women. So men especially should have some of the guinea hen weed. And we often traditionally have guinea hen weed root in a part of our root drink as well. So it's active against a whole list of different cancers. Now, how do they use it in Jamaica and the diaspora? You'll have it combined with dog blood, neem, moringa, ginger. And this is one of the combinations for prostate health. But again, how much? They'll do like 30 mils portions once a day or twice a day or in water or juice. So small portions or 2 tablets if it's in powdered form. They'll combine it in a root drink. Guinea root with your sarsaparilla, your strong back, your blood waste, your coconut shell, etc. This is an aphrodisiac. We have so many men that are having issues with erectile dysfunction, their prostate, etc. Creating that tonic helps to improve productivity or reproductive activity. Combining it for cancer, they do it with honey and garlic and molasses. So these different remedies have been done for different ailments. And then they give you the dosage in terms of 30 ml, 2 tablespoons, once for the week, and then you don't need any more. Or 1 tablespoon and you have it for 3 days and then you stop. So these are the ways in which some of the remedies are shared from generation to generation, neighbor to neighbor. And then we're seeing the therapeutic compounds in each of these plants. We know of garlic. We hear the term, one garlic clove a day keeps the cancer away. And we spoke about the sulforaphane and all those compounds that help. So many effects it can have, and you can literally add it to your food. Now, I often will say, garlic is so good at lowering the blood pressure. But if you're on blood pressure medication, and we'll talk about safety in a few, you can't have your garlic tea and then have your blood pressure medication. Because the garlic is going to drop your blood pressure and the medication is going to drop your blood pressure. So if both are in the stomach, in the body at the same time, it's like you're doubling the dose, tripling the dose maybe. And that's why it's important for healthcare professionals to know that if your patient comes and say, yes, I have garlic tea, we don't chastise them, but we educate them. We let them know you can't have it at the same time, or you don't do that. You don't have 2 garlic with your medication. So those things will help to educate the patients to say, or as a pharmacist, your clients, etc. How can you then help your body to heal, cooking it in your food, enhancing, but not causing some interactions? This plant, very popular. We see it all across the tropics, and it's called dog blood or inflammation weed. Dogs would eat this plant when they're sick, and it would help them. Any inflammation, it would help them. Eventually, we look at the structure of the plant, the phytochemical profile. It is immensely effective with inflammation. Talk about women's health and inflammation weed, Ravinia. It's important, or it is effective rather, in helping with clearing blocked fallopian tubes, helps with infertility. The berries are toxic. The beta xanthan used as a dye. We don't ingest the berries. And again, thin line between medicine and toxin. Which part of the medicinal plant would we use for a medicinal purpose? Herbal baths to help with cuts, wounds, and bruises, you'll use your dog blood or your inflammation weed. In different parts of Jamaica, I've heard inflammation weed because it's good for all type of inflammation and whichever inflammation you receive. Stinging nettle is another plant that's medicinal. Now, stinging nettle, as the name suggests, yes, it is the nettle that will sting, but it's also very medicinal because of that power as well. 1 cup, you can cook it. You can have it as callaloo spinach alternative. It's very nutritious. It has a lot of protein, but how do you pick this plant? I've heard in the, going on walks. I love going in the bush. I'm scared of lizards, but I love the bush. So you've heard the elders and persons will say, when you're picking it, you water it the night before and you walk near the plant and then you just pull it up. Why are they doing that? Science has shown us why. The stinging nettle, as soon as you approach a predator, a predator, herbivore rather, let's use herbivore approaches, it starts sending out those harmful chemicals to cause the itch. It will go to the clothes. It's part of the plant defense system. So it's always good to use a scissors to cut it, and then you'll have the medicinal power of your stinging nettle without having the scratch and the allergic reaction. Broadleaf or Plantago major, very good if you're on a hike, you get a cut, you have a bruise, grab some of the leaf, you crush it out. That's your natural salicylic acid. And we know salicylic acid was first extracted from the salix plant. That was used to make your aspirin. We've now modified the structure so much to have different anti-inflammatory medications, etc. It's also in your English Plantago. Allantoin, anti-aging and skincare. That also is in your Plantago, and that's how you can use it. It has been used for ages for a lot of skincare regime. It has a natural antioxidants. A lot of our cosmetic products today are having antioxidant enriched or salicylic acid, and we have it right in our backyards. What can you do? Grind up some leaf or make a natural product with some of your Plantago major. Leaf of Life, as the name suggests. I'll just do a few more of the plants. Leaf of Life, we drink it for so many ailments. You cannot get rid of the plant because once you pick the plant, you drop it anywhere. Once there's a little bit of soil, it will grow, even without a soil. Leaf of Life is antibacterial. It has antiviral properties. It is also a natural antihistamine, and that's why it's good for coughs and colds. It also has anaphylactic properties, which boils down to what is in the plant, what makes it medicinal, and how can we use it safely. Breast inflammation, mothers have used it for years. For abscess, they've used it, and you can just have it as a tea for different ailments. Dandelion is another plant that's often used for so many ailments. So it's a quick plant. We have dandelion that's found in temperate climates. We have dandelion in Jamaica. Two different genus, but both plants are used similarly. And that's the power again of nature. Wherever you are, there is a plant that will help to provide those nutrients you need. So if you're in temperate climate, you can get spinach to get your iron. You're in tropical climate, you can get your collard greens and your callaloo and so on. So nature helps to provide us with the remedies, the minerals and vitamins we need for our bodies. And quite a lot of research has been done with dandelion because it's so popular throughout. Marigold is another plant I'd like to share with Delia. Good with fibroids, looking at the antioxidant and the polyphenol, the phytochemical profile. It is very good with the female reproductive system. Go to the country and they ask you, I have fibroids, I can't get pregnant. They'll say you need to boil some marigold bush, your Wedelia bush, and sometimes they combine it depending on what the person say, with some pennyroyal, etc. Soursop, I've heard it mentioned this evening thus far. It is a medicinal plant, but it has significant anti-cancer properties, but also it can be toxic if we consume too much. Research has shown that it can affect the brain. It can cause different allergic reactions. Why? Excess. Nothing in excess enhances the body. Excess sugar causes diabetes. Excess salt causes hypertension. And we know the different biochemical parameters around that, but nothing in excess enhances the function of the body. We must keep it temperate. We must keep it moderate. I remember growing up watching Magic School Bus and carrots. One of the kids loved carrots so much, their skin turned orange. So we have to be moderate in everything we do. But soursop is very good for the nerves. It's a natural nervine, and it also helps with sleep, insomnia, and other factors. Checking for time. Lemongrass is a popular plant we use. It is very effective. Oxygen carrying capacity has been shown to be significant, helping with red blood cell count and ensuring that we have enough oxygen. And it's called fever grass because it does help to reduce fever. It has that effect. We could go into the biochemistry of turmeric or curcuma longa. It's one of the plants, if you're going to do a research in turmeric, you have to do an extensive literature review because there's so much being done across the globe. India, it's one of their staple plants that they use. It's so many skincare internal products and processes. What is the research saying? Anti-inflammatory, anti-cancer, antioxidant. It stimulates, causes, or enhances stimulation in some processes or pathways, while it inhibits in others. So these are a lot of ways where we can learn about what's happening. We put all the research together and then we can use these to see how do we then apply it. Neem was mentioned earlier. Neem is also one of my top medicinal plants. Neem, turmeric, aloe vera, moringa, top plants. Neem is called Azadirachta indica. It's a staple in India. It's a part of their Ayurvedic medicine. It's a part of their routine. All parts of the neem plant is used for therapeutic purposes. However, when we talk about consuming neem, we talk about the leaf. So toxicity, the oil, neem oil, cannot be consumed. You should not consume it. Ayurvedic medicine, they have different ways that they'll put a teaspoon, a little tiny bit in different formulations. However, on a natural or on a general level if you have if indigestion or colic, as we call it, drink some neem tea, soothe the stomach in less than 30 minutes. So I always have a pack of neem tea available because that's how quickly it works. Now, neem is so medicinal, it can lower the blood pressure. It has shown by research. You have nimbilin and different neem compounds isolated. It helps with managing the blood sugar and the blood glucose, but it's one of those plants that you do not overconsume. You'll have a cup of tea today, you have some tomorrow, you allow it to rest. You only need a little tiny bit for it to help enhance the function of the body. And that's why you'll hear, don't drink it, it's toxic. It is a strong plant, and therefore you have to be moderate in having the tea. Aloe vera, you know of the skin effects of aloe vera, the internal effects is nature's yogurt. So that middle portion of your aloe is nature's yogurt. You get your aloe, you peel it, you wash it, you blend the middle portion, you get your aloe, you get your natural digestive enzymes, you're enhancing your microbiome with your good bacteria. Now, if you get the green portion, you have a laxative. So that, again, where knowledge comes in helping to use your natural products on your plants. Ramgoat dash along, if you know, this flower is so beautiful, natural aphrodisiac. Research proven here with Turnera diffusa, looking at both men and women and how does it help within the Mayan civilization. The phytochemical profile shows your alpha copamine, your calamine, your beta pinene. There's so many compounds isolated. It's listed or recognized as safe by FDA as well, and it's added to a lot of food flavorings. So a lot of our plants, work is being done. We're trying to see how can we utilize our natural resources as much as possible. Castor plant or castor oil, good for our hair and skin. And in small doses, again, this is not a toxic plant. However, how can you use it to benefit health?
Dr. Daly, Dr. Campbell here. You have quite a number of, time is going, and you have quite a number of questions.
Oh.
And we'd love to hear about any adverse effects of some of these plants.
So that is it. So many plants, so many uses.
So many uses.
But how do we ensure that they're safe? May cause liver toxicity, allergic reactions, drug overdose, etc. Many pharmaceutical street drugs come from plants. So therefore, we have to be aware of the drug herb interaction. What do? Ensure that you're knowledgeable about the plants you're using. Don't just take somebody's word for it. Make sure you know the name and you get the correct plants. Once that is done, as mentioned before, you cannot have a herbal plant with a pharmaceutical. That's overdosing for a particular ailment. That's giving your liver too much work to do at the same time. It's basically similar to having overdose on a drug. So always separate your herbs. If you're having a herbal tea, it must be 2, 3, or 4 hours apart from your medicinal plants. And that's one of the general rules. Never have herbs with your pharmaceutical products. Generally, 1 teaspoon in a cup of water for a normal tea, and that should be fine again once it's not had together. And that's basically it, looking at how the body can heal if we provide the tools that it needs to build its immune system and help us to go through. But do not overuse our plants. We need to conserve our plants. So sustainability is important. If you pick it, plant it, and cut it sustainably. All right. Thank you so much for your time. And please do let me know if you have any questions.
Wow, Dr. Daly, this has been a most informative presentation. I mean, I must say, you know, for myself, I use quite a number of these herbs that you have mentioned. This ginormous neem tree at my house, many of the herbs that you've spoken about. So I know that many of my colleagues, they have questions. Some have put the questions in the chat, but let me go to the Q&A. Let me see the first one here. Doc, how can we extract this person's Dr. Burnett Tony referring to extracting a component from the periwinkle plant at home, and what is the dosage?
Right.
Yes.
So to do the extraction at home, you just need water. And that's a great thing about your medicinal plants. How convenient can we use it? Oftentimes, boiling it in water. So you get the mature leaves of periwinkle. About 3 of the leaves, they're really small, 3 leaves, and you'll boil it in water, and that is how you'll get that anti-cancer effect. Now, periwinkle is one of those plants that you don't have it every day. So you'll have that tea once per week and so on. There are other plants you can have every day for that same anti-cancer effects, like your moringa. It's very good in having every day.
All right. Dr. Dale, thanks for this presentation. What would you use for patients with angina?
When we look at food, we get lycopene sources. So those deep red foods are very good. So I'm trying to think of some foods. You have beetroot.
Yes,
you have
beetroot.
Your tomato, different forms of tomato. You have your deep purple carrots. Quite a few of those. And then when you look at your medicinal plant side, search me heart. Can't remember the scientific names for a lot of the plants now. Search me heart is a good one as well that you can use. But there are quite a few plants. And again, research can pull out some of the plants to see, is it effective and therapeutic, or what is the compound? Oftentimes, getting the phytochemical profile, you can often tell what the therapeutic effect can be as well.
Right. The next one from Tonette Grandison. Can you speak to the benefits of sorrel? Can we overdose on sorrel? I hope not. I drank so much. I drink it literally every day.
Well, sorrel can be had every day, so it's like a food. But one of the thing earlier you had asked, do we need to boil our herbs in metal containers? Now, sorrel is one that you would not boil. So if growing up, you normally would not boil sorrel in metal because the anthocyanin is so rich. When you finish boiling it in the pot, your pot looks clean. That's the cation reaction, the redox reaction happening there. You're pulling out the ions from your sorrel, from your pot. So your sorrel normally tastes different. You can't overdose on the soil, but if you realize your urine or your stool start looking red, you have a lot of anthocyanins that is being released or excreted from the body. If that's not happening, it's being metabolized properly.
Properly. The next question, what are your thoughts from Dr. Cooper? What are your thoughts on ashwagandha as a multivitamin?
Ashwagandha, definitely we call it a stress plant, adaptogen. I was trying to remember the
Adaptogen, yes, adaptogen.
adaptogenic plant. In that, wherever there's a stressor within the body, ashwagandha can help with that. So it's one moringa, ashwagandha. You have quite a few plants that are called adaptogens because of the different pathway it takes to help with improving overall health. Ashwagandha is one, but you also have quite a few side effects that persons can experience. So if you're doing it or you're having your ashwagandha powder tea for the first time, have it by itself and observe how you feel, often therapeutic quickly, and you don't have many side effects being experienced
Yes.
with.
The next question, do you have any suggestions for male infertility?
Yes, that's one of
Yes.
my specialties in terms of
Uh,
recommending our Jamaican herbs. Guinea hen weed if it's prostate.
mhm, Yes.
Guinea hen wheat. You have cheney root, your smilax, a smilax species. That's also good. Ravinia, good for women, but it's very good with inflammation. If anything inflammation like it's in the body, it will help as well. We often correlate the men's erectile dysfunction with their cardiovascular health. So looking at
Yes.
improving cholesterol levels, exercising, etc. But a lot of these herbs, your peanut, that also will help to
Mhm.
improve overall health. So having those roots drink with a lot of iron and a lot of your natural minerals can help with erectile dysfunction and male health.
Uh-huh. How would you advise someone with naturally low blood pressure on using these natural remedies that still have so many beneficial properties?
That's a great question because
Yeah.
I have normal blood pressure, but normal low. So if I drink certain herbal teas, I feel it right away. I feel a difference in my blood pressure. So I'll have some salt or I'll have something salty. If you're on blood pressure medication, neem, you cannot have it close to your medication time. Neem is strong, Cersei is strong, and quite a few of your other plants are strong. So therefore, you have them at separate times. Now, it will help over time if you're having them. It will help to eventually help your body to work on less dose of the pharmaceutical, but it takes consistency for you to achieve that over time.
Let's take one more question because, and I'm going to ask you to answer the other questions in the chat. This question, how can we find the correct dosages for these natural remedies?
All right, for correct dosages, I would say use them as a tea. Now, the rule of thumb as a tea, 1 teaspoon in 1 cup of water. That is a general use that you can get the benefits. For medicinal purposes, you'd have to have that therapeutic dose being identified. That has been done for quite a few plants, turmeric, ginger, ashwagandha, and therefore you'll have those recommendations on a lot of tinctures, a lot of functional foods. So you can literally buy those. You can go to a naturopath, registered herbalist, and you can get the different dosage. But if you're just looking at enhancing your food and what you eat and drink on a daily basis, just having your tea bags or getting your herbs, 1 teaspoon in a cup of water will be a general rule to go ahead.
Wow, Doc, thank you so very much. And excellent, excellent presentation all round. These are the comments. Thanks for your presentation. Excellent presentation. And I do believe that AGP has to have another seminar like this and have you to continue with your presentation. So all the best to you. And please remember to answer the other questions in the chat.
All right. Thank you so
Okay.
much. And thanks
You're
for having
welcome.
me.
You're welcome. Take care. We're on to our next presenter, Our next presenter is well known to us, and he is Dr. Alverston Bailey. And Dr. Bailey's career exemplifies excellence in family medicine, public health, and medical education, leaving an enduring impact on the Caribbean and beyond. Dr. Bailey has been president of the Caribbean College of Family Physicians, CCFP, from 2002 to 2006. He has also been president of the Medical Association of Jamaica from 2005 to 2007. Since 2017, I should say, he has been chairman of the MAJ Foundation, and this has helped to support incapacitated members of the Medical Association of Jamaica, and this reflects his commitment to healthcare professionals' well-being. He has delivered many presentations and authored Sexplanation, a guide to discussing sex and sexuality in the Caribbean. And he has had many awards have been he has received many awards. Tonight, Dr. Bailey is going to speak to us about ethics and complementary medicine. How do we address this moral haze? Dr. Bailey, Alveston, over to you.
Thank you very much, Dr. Campbell. Before we begin, I could ask the IT to just post the pretest, which actually is a short case study in which a doctor had an ethical question and you'd be invited to answer. You are allowed 60 seconds to, to read the pretest, and I'll read it for you. Miss A, a 65-year-old woman with hyperthyroidism, was referred to psychiatry for worsening anxiety and insomnia, despite taking diazepam for 2 months after panic attacks were misinterpreted as a heart attack. She reports racing thoughts, restlessness, and only 3 to 4 hours of sleep nightly. She denies a history of mania, hypomania, or prior panic attacks. Social history reveals visits to an out-of-sight holistic doctor who prescribed megadoses of iodine for years, claiming low iodine levels. Mrs. A discontinued iodine per her integrative physician's advice, but resists Western quote-unquote medicine, citing lifelong avoidance. Her anxiety remains unresolved. The next slide, please. So, your task is to tell me which of the following is or are the most appropriate next steps for the psychiatrist. And so you are to choose whether you would inform the patient that unless she agrees to use Western medications as prescribed by the psychiatrist will be unable to continue seeing her as a patient. Or B, do further research, example, by searching the medical literature, consulting with an endocrinologist or both regarding the possible connections between the patient's use of megadoses of iodine and her hyperthyroidism. Or would you choose C? Try to convince the patient that Western medicine is more evidence based than is CAM and therefore is in the patient's best interest. Or would you choose D? Explore with the patient what her goals of treatment are and try to build rapport with her around addressing these goals in a collaborative way. You are allowed 60 seconds to choose all of the above, one of the above, three of the above, or two of the above.
All right, everyone was given a minute. I hear the results on your screen, Dr. Bailey.
Okay, thank you very much.
33% said B, 1% said C, 86% of persons said D, no one selected A.
All right. Did you get a combination of answers? And this is the answer. The correct responses are B and D. The psychiatrist should try to balance respect for the patient's autonomy by exploring the goals of care and working with her to establish a collaborative approach to a treatment. The psychiatrist should also try to understand better the possible etiology of the patient's symptoms in relation to a supplement use. It may be difficult to link these definitively, but the possible side effects of large doses of supplements should be discussed with the patient in order to minimize harm. Thank you very much, sir. I'll now go back to my slides.
No problem. I'm gonna have to ask you to just share again, and then we should be good to go.
Okay, no problem. Will do. Okay, and I'm on. Thank you
Yeah,
very
we
much.
just need you, if you could just click on slideshow so that it goes full screen, and then we're good to go.
Right, no problem. Let me just. Da. Oh, there we are. Colleagues, I'm very pleased to be asked tonight to share my thoughts with you about the ethics of complementary medicine. It is a maze. From the discussions we have had before my lecture, it's obvious that we have a lot of food for thought. This lecture will review the definitions of alternative and complementary medicine, provide a brief overview of the common options being used worldwide, present an overview of the ethical challenges posed by CAM, provide an in-depth lit review of ethical challenges posed by common practices, and propose solutions to these challenges. My lecture will be very evidence-based, and I've sent a summary of the lit review to AGPJ, which you can access if you would like to delve deeper into the various papers written. I'll be just giving a brief summary of at least 30 papers from around the world. Just to remind you that the fundamental principles of ethics are autonomy, beneficence, non-malfeasance, and justice. Autonomy speaks to respecting a person's freedom to choose what's right for them. Non-malfeasance means to do no harm. Beneficence is that all choices for a patient are made with intent to do good. And finally, justice, to treat and provide care fairly for all patients. So what is CAM? Ernst and his team in 1995 offered a definition that I like. There are many definitions, but I like this one. Please bear in mind that all my thoughts are evidence-based. You can feel free to take a screenshot of the citation so you can delve deeper into the research at your leisure. Ernst described CAM as a diagnosis, treatment, and/or prevention which complements mainstream medicine by contributing to a common whole, satisfying a demand not met by orthodox or diversifying the conceptual framework of medicine. The 5 domains of CAM as presented to you by the first speaker are energy therapy, biology-based, alternative medicine, manipulative and body-based, and mind-body medicine. The energy therapy would include Reiki, magnets, therapeutic touch, and what I think is described as Qigong. Biological base would be, as discussed just now, herbal supplements, therapeutic foods and diet. Alternative medicine would be homeopathy, naturopathy, traditional Chinese medicine, and Ayurveda. Manipulative and body-based would be massage, chiropractic practices, and osteopathic medicine. And of course, mind-body medicine would include many types, including yoga, tai chi, and meditation. What are the statistics? Well, when I scan the literature, the most popular forms of CAM worldwide, interestingly, are as listed on the slide. The most popular one being fasting, and the least popular aromatherapy, with a large number of other options in between. I'll be going through some of these when I discuss the evidence. The 10 most common CAM practices in the USA in this 2012 paper was, and this is in keeping with the discussions that we've had previously, that most persons in the USA preferred natural products, followed by deep breathing, followed by yoga and Tai Chi and so on, followed by chiropractic manipulation, then meditation, followed by massage, again special diets, homeopathy, progressive relaxation, and guided imagery. And many of these were discussed previously. Interestingly, in children, the most common CAM product were natural products. What are the ethical challenges of CAM? I'm going to provide for you a brief overview, then I'll delve into some evidence. The first one is patient autonomy and informed consent. A fundamental ethical principle in healthcare is respect for patient autonomy, which hinges on informed consent. In the context of CAM, this principle is often compromised by the lack of standardized information about therapies. CAM practices frequently lack what is described as rigorous scientific evidence to substantiate their efficacy, and often relies on case studies and lived experience. Patients may be provided with anecdotal rather than evidence-based claims, which can lead to misinformed decisions. Additionally, complex language and unregulated practices may hinder patients' understanding of risk and benefits, further undermining informed consent. And this, in fact, is seen a lot in our markets where Mike's blaring out the benefits of CAM from persons about whom we know nothing. Then we have safety and efficacy concerns. The safety and efficacy of CAM remains a significant ethical concern. The reality, colleagues, is that many CAM practices really lack robust clinical trials, and the operative word is robust. And there is inadequate regulation, leading to variability in quality and the risk of harm. It is also known that herbal medicines, which sometimes appear on the streets from strange and wonderful places, may contain contaminants or, as stated before by the two speakers, may interact negatively with prescribed medications. The ethical dilemma arises, and many of you now listening to me will appreciate my concern, that the ethical dilemma arises when patients unwisely abandon proven conventional treatment in favor of CAM, risking adverse outcomes or delaying necessary care. Therefore, we as healthcare professionals face challenges in balancing respect for patient choices with their duty to provide evidence-based recommendations. And the reality is that in many instances, the evidence is just not available. Then we have this most worrisome ethical challenge, which is professional integrity and boundaries. Healthcare providers who integrate CAM into their practice often face ethical dilemmas about professional integrity. Many of us are conventional medical practitioners, and patients may encourage you to endorse CAM therapies despite your personal skepticism or insufficient evidence. So many of you are faced with the dilemma of agreeing with what the patient recommends or even offering the patient what they desire, but you yourself have inadequate information to inform your decision with safety and efficacy, or you might just do not believe in the approach a patient is recommending, and that poses a problem. This, therefore, can create tension between maintaining professional credibility and accommodating patient preferences. Moreover, the lack of formal accreditation for many CAM practitioners raises concern about accountability and competence, because there are many persons who offer CAM therapies who really have never been certified in delivering such therapy. Then we have access and equity issues. The accessibility of CAM therapies varies widely, often influenced by socioeconomic factors. We know that some CAM practices are deeply rooted in cultural traditions and accessible in their communities, but others are commercialized and priced beyond the reach of marginalized population. And so that poses a problem, that the price of evidence-based effective CAM therapies might be beyond the reach of the common man. Ethical concerns arise. Therefore, when patients are unable to access effective CAM due to cost barrier, or they're just too far away, or it's not available in their country. Therefore, some argue that CAM affordability relative to conventional medicine can enhance access to care to underserved population if it is affordable. And then you have cultural and social implication. And this is one of the most challenging aspects for many of us. That CAM is often intertwined, closely aligned with cultural and spiritual beliefs. And therefore, you need to have a culturally sensitive approach to its integration into healthcare. Ethical challenges then emerge when dominant medical paradigms try to marginalize traditional healing practices. And this could lead to what is called cultural erasure or disrespect for indigenous knowledge systems, which goes back to thousands of years. On the other hand, and this is what I'd like to bring to your attention, uncritical acceptance of CAM without rigorous evaluation may perpetuate what the experts have described as pseudoscience and undermine public health initiative. So the recommendation is that we should strike a balance between cultural respect and scientific integrity. Now, what I would like to do over the next few minutes is to look at some common CAM practices and present to you the evidence that I've gleaned from a review of the literature. Some of the conclusions might make some of you feel uncomfortable, but I'm presenting to you the evidence. I'm strongly inviting you to take a screenshot of the references and review the data yourself. I'm going to be looking at homeopathy, acupuncture, herbal medicine, chiropractic care, Reiki and energy healing, naturopathy, Ayurvedic medicine, and traditional Chinese medicine. I'll present to you some of the ethical challenges posed by each of these well-known practices. The first one is homeopathy. The three ethical challenges that one has to address with homeopathy is efficacy. The second one is informed consent. And the third is resource allocation. Let's look at efficacy. The Australian National Health and Medical Research Council conducted a comprehensive review of the evidence regarding the effectiveness of homeopathy in treating various health conditions. And these were their findings. The review concluded that there is no reliable evidence to support the efficacy of homeopathy for treating any health condition. Studies claiming positive outcomes were found to be methodologically flawed, including small sample size, poor design, and lack of replication. The recommendation by this group is that homeopathy is no more effective than placebo. The information gleaned for this lecture is shown in this slide. I'm going to strongly recommend that you take a screenshot of the references as I go through them so that you can retrieve the information and go through them yourself. The next concern is informed consent. A study done by Ernst and Smith 2018 critically evaluates the ethical consideration and potential harm associated with the use of complementary and alternative medicine. The authors explored the balance between potential benefits and risk, focusing on ethical dilemmas. And their conclusion were that there was significant ethical concern, including the use of unproven treatments, lack of transparency in efficacy claims, and potential exploitation of vulnerable patients. Evidence suggests that some CAM practices can delay effective medical treatment, posing risk to patient health. Therefore, this review underscored the lack of robust scientific validation for many CAM modalities. And this is the reference. And the reference was quite provocative, actually. It says, more harm than good, the moral maze of complementary and alternative medicine. You can look it up. The next issue with homeopathy was resource allocation. The evidence check 2 homeopathy report by the House of Commons Science and Technology Committee 2010 evaluated the scientific evidence supporting homeopathy and examined its inclusion in public funded healthcare in the UK. The result concluded that there was no robust scientific evidence, there was mechanistic improbability, public funds should not be used to fund homeopathic treatment due to lack of evidence, and the report raised concerns about the regulation of homeopathic products. And this is the reference for those results. Let's look at this rather fascinating approach, acupuncture. And I'm sure there are many of you now sitting on the edges of your seat to try and determine what is the evidence. The results might be rather surprising. It addressed 3 issues: cultural sensitivity, patient safety, and the placebo effect. With respect to cultural sensitivity, Barnes, in another very provocative paper called Needles, Herbs, Gods and Ghosts, explored the historical interplay between Chinese medicine and Western perception, focusing on how traditional Chinese medicine was understood and adapted in the West prior to 1848. Its results showed that there was a lot of cultural misunderstanding. Western perceptions of TCM were deeply influenced by existing biases and misunderstanding, leading to selective adoption and oversimplification of Chinese practices. There were also hybrid practices. Adaptations often stripped Chinese medical practices of their spiritual and philosophical underpinning, recasting them in ways that align with Western scientific or colonial worldviews. And knowledge exchange was another challenge. While some genuine knowledge transfer occurred, much of it was tainted by the West's exoticization and commodification of Chinese medicine. Citation is from Barnes, 2003, as shown in this slide. Check it out. What about patient safety? A study done by Kim et al. In 2013 reviewed adverse events associated with acupuncture as reported in Chinese medical literature, and they offered insight into the nature, frequency, and severity of these events. Stand by for the results. The results were: the study identified a range of adverse events with minor issues like pain, bleeding, and bruising. The most common: But serious complications such as pneumothorax and infection were rare but highlighted. Most adverse events were linked to, and this is an important point for us to bear in mind. There's so many camp practitioners around that were not properly trained. So most adverse events were linked to inadequate training of practitioners, poor technique, or, and this is an important take-home point, the use of non-sterile equipment. The report noted inconsistencies and underreporting of adverse events in the literature. And the citation is shown in this slide by Kim and his team. What about the placebo effect? A study done by Vickers et al. 2012 conducted an individual patient data meta-analysis to assess the efficacy of acupuncture in treating chronic pain, including back and neck pain, osteoarthritis, chronic headache, and shoulder pain. This was a study with a lot of power. It looked at 29 randomized controlled trials and almost 18,000 patients. Therefore, the power of the study was high. The results were that, and this might be pleasing to many of you, that acupuncture was superior to sham acupuncture, and patients receiving acupuncture reported less pain. So that's good news. And the reference for that is Vickers and his team, 2012. Take a screenshot, check it out. Now, herbal medicine. Now you're sitting on the edge of your seat. What does the literature say? The two colleagues who present before me presented fairly compelling arguments about the usefulness of herbal medicine, especially our local herbs. I did not see any literary review about Jamaican herbs and its safety and efficacy and its dose and its pharmacokinetics and pharmacodynamics. So I present to you the data from the world literature. They looked at safety, regulation, and sustainability. A study done by Posadsky et al. In 2013 provided a comprehensive overview of herbal medicinal products. The primary aim was to summarize and critically evaluate existing evidence on what is for many of us a concern, which is the adulteration and contamination of herbal medical products. The researchers looked at 5 electronic databases to identify relevant systemic reviews. And the power of the study was high. 26 systemic reviews met the inclusion criteria. And the findings were that many HMPs were oftentimes adulterated with dust, pollen, insects, rodents, parasites, microbes, fungi, mold, toxins, pesticides, toxic heavy metals, and prescription drugs. So we have to approach these HMPs with caution and determine the source from which they came. And this was a paper published by Posadsky et al. In 2013. You can have a look at it. An article by Bent in 2008 highlighted the widespread use of herbal medicine in the US and examined the evidence supporting efficacy and safety. It also looked at the regulatory framework governing these products. The results were that some herbal medicine are effective, but many lack robust evidence. Safety concerns were also noted with regard to contamination and interaction with conventional medicine, which is in keeping with what was said by the two speakers, that herbal medicine can interact with conventional medicine and should be taken with appropriate instruction. It also emphasized that existing regulations do not guarantee the safety and quality of herbal products, and this is a major issue. Herbal medications are oftentimes unregulated. The reference is from Bent, published in the Journal of General Internal Medicine. A study by Van Andel et al. examined the sustainability of commercial medical plants in Suriname, and they found that certain species are at risk due to over-harvesting. So one has to bear that in mind. And if you have good medicinal plants, we must not over-harvest them. That paper was published by Van Andel in 2008. Now, this one is really interesting, and I really want you to pay attention to this. And I really would strongly recommend that you download the papers and look at what the authors had to say about chiropractic care. Please bear in mind, this is not my opinion. These are, I'm just presenting to you the evidence. The evidence looked at scope of practice, autonomy, and transparency. An article by Ernst in 2010 critically evaluated chiropractic care, focusing on its history, internal conflicts, core concepts, efficacy, safety, and the role of chiropractors in healthcare. The results were that the concept of subluxation lacked scientific support. They argued that spinal manipulation, even though it offered modest benefits for certain types of back pain, showed limited evidence in its efficacy for other conditions. And they are of the opinion that cervical spine manipulation could possibly impact negatively on the vertebral artery. We need to bear that in mind. And perhaps prior to manipulation, ask the patient for informed consent. And this paper was written by Ernst, 2010, chiropractic critical evaluation. And what I found interesting about this paper is that it was published in the Journal of Pain and Symptom Management. Autonomy with respect to chiropractor was looked at by Walker et al. In 2011. He evaluated the effectiveness of chiropractic intervention for low back pain. They analyzed clinical trials to assess the efficacy of chiropractic care, which often included spinal manipulation. And the conclusion was that compared combined chiropractic intervention to other placebo was that there was limited evidence to support the superiority of combined chiropractic care to other intervention. Some studies actually only showed modest benefits for chiropractic care. And the reference, please make note of this, my colleagues, was by Walker and French et al., published in the journal Spine in 2011. Please look up this paper so that you can offer patients informed consent so that they can experience autonomy. What about transparency? This was looked at by Mertz et al. In 2009 and investigated the prevalence of subluxation in the curriculum of North American English language doctor of chiropractic program. And they conducted a comprehensive review of chiropractic college catalogs to determine how frequently this term was used. And the results show that the term subluxation is commonly included in the educational materials of many programs. And this was the paper, Mertz et al., published in 2009. Let me take a look now at Reiki and energy healing. The three ethical issues with respect to this is its scientific validity, the possibility of exploitation, and accountability. With respect to scientific validity, a paper done by Lee and his team in 2008 evaluated the effectiveness of Reiki in clinical practice. And it revealed that the existing trial did not provide robust evidence supporting the effectiveness of Reiki for the condition studied, and that the methodology of many of the trials was limited. Reference I would like you to check out is by Lee, published in 2008 in International Journal of Clinical Practice. With respect to exploitation, The study by Flint and his team examined ethical concerns surrounding the use of complementary and alternative medicine in vulnerable populations. They discussed how certain camp practices may exploit these groups, leading to harm and ethical dilemmas. There were several unethical practices that were noted. One was the promotion of unproven and potentially harmful treatments. Two, the lack of informed consent. And three, the targeting of individuals with limited access to conventional healthcare. And also note that there was not appropriate regulation of these practitioners. This paper was published in 2018 by Flint and his team. This was published in the Journal of Medical Ethics. Take a screenshot, check it out. With respect to accountability, Hyman in 2007 discussed the importance of balancing scientific rigor with practical relevance when evaluating CAM. It emphasized the need for research methodology that are both scientifically robust and applicable to real-world clinical challenges. The results was that there was a challenge with respect to the limitations imposed by traditional research methods in evaluating CAM. Noting, and the first speaker did mention, that while randomized controlled trials are the gold standard, they might not capture the essence of CAM intervention. And therefore, the approach that we should adopt going forward is to create a balance between the rigor of the study and practical relevance so that we can provide a reasonable conclusion to those who are practicing CAM and those who plan to do so. And this paper was published by Hyman in 2007, which appealed to all practitioners to balance rigor with relevance. And this is an important point because CAMs oftentimes has cultural and spiritual components. Naturopathy. There are some ethical challenges which I'll explore. One is integration with conventional medicine. Two are training standards, and three, patient expectation. A study done by Meyer and Weiger in 2019 provides a systematic scoping review of the evidence supporting whole system, multimodality, naturopathic medicine. The author tried to assess the effectiveness of naturopathic approaches that integrate various modalities within a unified system. And the conclusion were that whole system, multimodality, naturopathic medicine, which was discussed by one of our colleagues, is effective. And I think you'll be very happy about this. Let me repeat. Whole system, multimodal, naturopathic medicine is effective in treating conditions such as cardiovascular disease, musculoskeletal pain, and type 2 diabetes. That's a good take-home point. But because we're dealing with rigorous evidence-based data, they argued that the quality of the evidence varied and there was difference in methodology and rigor. But it works for cardiovascular disease, musculoskeletal pain, and type 2. I'm sure it works for other things, but I have not seen the evidence yet. So this paper, which I'm sure you're going to screenshot, Myers and Weiger, 2019. Please take a screenshot of this and look at the paper. It's just about 27 pages long. Training standards. The study by Smith and Cochrane in 2015 reviewed randomized controlled trials to evaluate the efficacy of naturopathy, and he looked at the quality and outcome of RCT involving naturopathic intervention across various health conditions. The analysis identified several RCTs assessing naturopathic intervention for conditions such as asthma, osteoarthritis, and irritable bowel syndrome, and they appeared to work. But the main concern that they have was that there were methodological flaws with respect to sample size and potential biases. So when they subject naturopathy to rigorous scientific inquiry, it came up wanting and is a matter that we need to explore. This was done by Smith and his team in 2015, published in the Medical Journal of Australia. With respect to patient expectation, the study by Ernst examined scientific basis, efficacy, and safety of naturopathy, and they concluded that many practices lack a solid scientific foundation with limited evidence. And the operative word is solid. They didn't say it didn't work. It was that this scientific foundation was not solid. The clinical efficacy of many naturopathic treatments were not proven in this study, but some of the studies demonstrated significant benefits. When you download the paper, you'll identify these benefits, which I already mentioned, with respect to cardiovascular disease and so on. And that some intervention may pose safety risk. The paper was by Ernst, 2019, Naturopathy, a critical appraisal. Take a screenshot, look at the paper, and you will see the evidence. Ayurvedic medicine. I look at toxicity issues, cultural co-modification, and regulatory oversight as ethical concern. With respect to toxicity, a study done by Sapper et al. Investigated the heavy metal content in Ayurvedic herbal medicinal products, highlighting potential risks associated with their use. And we're trying to assess the presence of heavy metals such as lead, mercury, and arsenic in these medicines. If you look at bullet number 3, it was a very powerful study. They purchased 230 products from 13 countries to determine the extent of contamination. 230 products from 13 countries. And the conclusion was that 1 out of 5 of the Ayurvedic products contain lead, mercury, arsenic. 14% of the product had lead concentration 10 milligrams per 10 micrograms per gram, which is potentially harmful. And mercury and arsenic were found in some products with concentration varying across different samples. And the reference is by Snape et al., published in 2004. Please check it out. With respect to cultural co-modification, this was a book by Banerjee. He explored the intersection of power, knowledge, and medicine within the context of Ayurvedic pharmaceutical. And he identified that there were challenges of preserving traditional Ayurvedic practices while adapting to global standards and commercial demands. So this is an issue that we need to explore. Therefore, he concluded that Ayurvedic pharmaceuticals are at a crossroads, balancing traditional practices and modern influences. With respect to regulatory oversight, Mukherjee in 2002 examined the safety, efficacy, and regulation of Ayurvedic medicine, emphasized the need for scientific validation to ensure quality and safety. And he concluded that many products lack standardized quality measure. And that's an important point we need to bear in mind when we entertain the thought of using Ayurvedic products. The paper is by Mukherjee, published in 2002 in the Journal of Ethnopharmacology. Check it out. The final one I'm going to look at is traditional Chinese medicine. Now, I'm not an expert in traditional Chinese medicine. I'm presenting to you the evidence that I unearthed. There might be more evidence, but this is what I unearthed. I've been looking at the literature worldwide. With respect to Chinese medicine, the study examined the challenges faced in conducting evidence-based research on TCM. The authors discuss issues such as methodological limitation, lack of standardized protocols, and the need for rigorous clinical trials to validate the efficacy and safety of TCM. There are some challenges with respect to TCM which could impact on its ethics. Many studies lacked robust design, leading to unreliable results. there were variations in TCM formulations and practices which impacted negatively on the research protocol. But most importantly, there were the absence in many cases of standardized regulations, therefore impacting on quality control and validity. This paper was published in 2015 in the Journal of Alternative and Complementary Medicine by Zhao et al. You can take a screenshot and have a read. This is a major issue with TCM, animal ethics. It highlights the demand for parts from endangered species such as tiger bones and rhinoceros horns, and discusses the consequence of this practice on wildlife conservation and animal welfare. And these were their findings: that there was a high demand for specific animal parts, which contributed to the decline of various species. For example, the black market for rhinoceros horns reduced the global rhino population by over 90%. There was illegal and wildlife trade. And interestingly, I had no idea, but I now know that there is a serious black market for cattle gallstone, which actually goes for $5,800 per ounce for cattle gallstone, which is part of TCM. There's also a TCM called bear bile, which is extracted from bears. And over 12,000 Asiatic black bears are held in bear farms, where bile is extracted through permanent abdominal holes, leading to significant pain and distress. So when you get some bear bile extract, you're involved in animal cruelty. Therefore, they concluded that use of animal products in TCM poses substantial environmental and ethical challenges, which we need to bear in mind. And the data for this summary came from CLJ 2003, which you can have a look at. Globalization is another ethical issue. This paper looked at the globalization of traditional Chinese medicine and ethical challenges that arise when it is integrated into other cultures. It explored how TCM practices are oftentimes adapted and transformed into fitting in to the culture in which they are now placed, highlighting ethical dilemmas encountered in this process. Therefore, ethical challenges were cultural appropriation, in that the adoption of TCM practices in non-Chinese context, adopted word is non-Chinese context, raises concerns about misrepresentation and co-modification, which means they're modified to suit your culture. And there's also an issue with intellectual property rights. There's also challenges in regulatory standards across countries, which could impact on safety and efficacy. And of course, the fact that it oftentimes uses plants and animal parts could impact on biodiversity. This paper was written by Etsu in 2008. You can check it out. So,
Dr. Bailey, in the
yes,
interest of time, we're a little after 10 p.m., and there are
yes,
some comments that I'd like you to address.
no
Um,
problem. I'm going to wrap
okay,
up. No
okay.
problem. So, how do we navigate these ethical challenges? Well, I'll go through this quickly. We need to emphasize evidence-based practices. In the absence of evidence-based practices, it's a challenge for many physicians to use CAM with certainty and assuredness that they are safe and effective, especially with respect to dosing, with respect to duration of treatment, and respect to frequency. We also have challenges with respect to the pharmacokinetics and pharmacodynamics of many of these products. You need to promote patient autonomy and informed consent, i.e., ensure patients are aware of all the risk involved in using a particular procedure, or product and let them make their decision based on information. We need to bear in mind the cultural sensitivity of many of these particular practices. We need to seriously push for regulation of CAM so that the guidelines are uniform and the standards are clearly defined. We need to promote sustainability and environmental responsibility by not over-harvesting plants or damaging animals. And of course, we need to strengthen professional accountability, which means that we need to adhere to codes of ethics and emphasize patient safety, scientific integrity, and environmental responsibility. Of course, we need to avoid exploiting people who are ignorant and uninformed. And most importantly, and this is the last one, encourage multidisciplinary collaboration so we can work together as a team to unearth the usefulness of these various approaches and help each other to have a better understanding of CAM. In conclusion, the integration of CAM into healthcare presents profound ethical challenges, but we can collectively overcome them by ensuring that they are subjected to rigorous scientific evaluation, they are regulated robustly, and that we are sensitive to patients' culture and spirituality. Thank you very much.
Thank you, Dr. Bailey, for, helping us to see the other side of the coin. I know you like to do this, but, looking at some of the comments, quite a number of comments from Marcus, I think, McFarlane. The cons you speak of regarding karma only exists in the West by design. If you research Eastern traditional medicine, example, TCM, traditional Chinese medicine, you would be amazed. Any comments about that, Doc?
Or is it to respond to that? When I look at literature, the problem we have with respect to research, and if the data is not available or accessible, I'm talking about appropriate evidence-based data. It's very difficult for you to make an informed commentary, which is why in most of the lit review, they did say that the evidence has not been presented or the evidence is not sufficiently robust. Of course, you being an academic could understand what they mean, that they actually are trying to determine if the particular treatment modality is reproducible and that if it actually can be applied across all cultures, and especially with respect to dosing and respect to the dose response curve, the dosing oftentimes poses a problem, the duration poses a problem, and they also have a significant problem with frequency. And so, because there's no uniformity of thought with respect to many of these approaches, it's difficult to say with certainty, especially for the Western doctors, that this has been shown conclusively to work. Because the reality is, because there's a cultural component, it might very well work in another culture, but when you transfer it to a different culture, which doesn't have that cultural or spiritual basis, it might not work. So there are a lot of unanswered questions, and I agree with the person that Chinese medicine has apparently been working for years, but when you transfer it to the West without that underpinning of culture and spirituality, apparently there's a challenge. And so we're not saying it does work. What we would like is for us to really see the evidence. And so if the colleague who just wrote that could send to AGPJ the clinical evidence that supports TCM, that is robust, that is compelling, and is trustworthy, which are some of the key terms we use in research, then I'd be more than happy in another forum when we make another presentation to present this.
Yeah, that would be good because with TCM we have to bear in mind that Chinese medicine involves the use of herbs, and you have acupuncture, and there's so many other things that can be used. Anna Brown Morgan made the comment. Oh, where is it now? With Anna J. Made the comment basically about the yes, and Marcus McFarlane says the same thing. If CAM is hogwash, then why are the top universities training practitioners in CAM? I leave that to
Well,
another time, Al.
no, actually,
Because
I never resort in an academic discussion to the term hogwash because one is
yes,
not saying
yes,
that
but
at all. So that's emotive, and because when I actually there are, and the first speaker could tell you, the list of CAM procedures is long. It's very, very long. And there are many of them that are extremely good, like fasting, like massage therapy, like meditation. So the CAM by its very nature, it covers a wide area of options. And so
diverse
very,
practices.
very diverse. And therefore it's not CAM per se, which is why I opted to just choose some of the more controversial ones. But I definitely would not get involved with prayer works. I wouldn't get involved in massage works. And so,
But
so
I will sort of have almost the last word. When
please do.
massage at first started out, it was thought of as an alternative practice. It's just that now it has been integrated, and now everybody going for a massage. And I leave you with this question. I'm sure people may want to may ask, do you have to prove that God exists before believing that he does?
Oh dear.
Well,
I,
and
I, 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 I decline to respond because that is
you decline to respond.
outside of my scope.
I'd love to. We've come to the end of this very informative, fascinating seminar, and I'd just like to thank a number of persons. Thanks to Mrs. Lynn Thompson Hyatt, Administrator of the AGP Secretariat. Thanks also to Mr. Sam Heron of Allgate Solutions for their efforts and arrangement for this seminar. Thanks to our presenters, Dr. Janice Simmons Fisher, Dr. Denise Daly, Dr. Alvaston Bailey, who have significantly added to our knowledge base. Thanks to our audience, our patient audience. Thanks to you for your participation, robust participation, I must say. We could probably go on another 2 hours. We won't. And your attendance. Best wishes to everybody. Good night. Take care.
Good night and take care. And we want to say thank you to you as well, Dr. Jackie Campbell. Wonderful moderator. Thank you so much for shepherding us through this evening. And thanks everybody for joining. The instructions again for your CMEs are attached in the chat. Make payment using the link that says Figaro. And of course, copy your email confirmation that you receive and share it with the AGPJ secretary at agpjsecretary@gmail.com, and certificates will follow. Have a wonderful evening, everybody. Stay safe.
Thanks.
Bye bye.
Take care, Sam. Bye bye, everybody. Bye.
Bye bye.
Bye.